Okay, welcome everyone. Thanks for coming back for day 2 of this training. Today is live. Also want to thank the interpreters. They're here. Thank you for being with us today. Hopefully there weren't many issues. We heard from a few people yesterday with some getting on the webinars, but I think we're assuming that most people were able to access those and get on those webinars without much trouble. So if you are having trouble, please reach out to us. We just want to go through a quick outline of what today's going to look like. Maddie, do you want to bring that up? Okay, there we go. So we are going to start off with some allowable, unallowable costs, talk about indirect and match. And then we'll take a short break. And then Danette and Tally will talk to us for quite a while about the certified assurances and grant conditions. Then we will break for lunch. We may get done earlier in the morning. If we do, we are still going to wait until 1 o'clock to start the afternoon session. So even if we end earlier, you just get a longer lunch. And then we'll come back at 1 and Wendy and Bree will talk to us about monitoring. And then we will end the day with confidentiality and some questions and answers. The Q&A is open. You can put questions in there. And then we will also answer some questions that were put on the Google form from yesterday. I think I've covered everything to start. So we'll go ahead and I believe we're going to turn it over to Dale first.
Thank you, Maria. Good morning, everyone. Very happy to be here again. I feel like we've done this 6 or 7 times now since I've been here. It's always great. It's a long day. It's a long training. It used to be 2 days long, and it used to be something that we traveled the state for. We are trying to move into this new era of online training and modules, and we're going to continue to try to improve our processes with this and try to make it so we don't have to take up 2 full days of your guys' time, which is great. So with that, let's just get started. We're going to talk about grant costs. And if you go to the next slide, one after this, sorry, reimbursement grant, we'll get that to that later. I'm just briefly going to talk about the VOCA allowable and unallowable stuff. And then we will continue with the other funding sources that we have with this office. So I'm not going to get into a too exhaustive list. We've done this in the RFP training. You guys have this in your instructions. But in general, for VOCA, it has to be reasonable, necessary, allocable, allowable, consistent with federal agency policy, procedures, and not being used as match for other federal grants if you do have federal grants. So you can't match twice. It has to be around direct services and activities supporting direct services to victims of crime, address the immediate emotional, psychological, and physical health and safety services that respond to immediate needs of victims. Now, Maddie, I think she just put in the chat. Let me pull that up real quick. But we have, for some reason, our website's giving us problems as of last night. So I just wanted to show you guys there's a more exhaustive list on our website for you guys to see all this stuff. And it looks like she did get it up. You have to jump through a couple of hoops to actually get there. After this training, I'm going to contact DTS and have them fix the website. I just didn't want to do it while we were in the middle of a training, and then the whole website happens to go down and we can't access any of it. So Maddie, if you just scroll down on this list a little bit, it shows the allowable direct services cost. And then if the site's working right, yep, it expands and gives more information about everything that's allowable for VOCA. And then the allowable costs for activities supporting the direct services. So we're supporting direct services and the activities to support those direct services as well. And what's allowable as far as the administrative costs with your guys' agencies and what is allowable for that, which we do try to help as much as we can, as much as the federal rules allow us to help run your agency, support the people that are working for your agency, and those that are helping victims of crime across the state of Utah. And Maddie, you can stop on unallowable costs. We do have another slide after this, but I guess we can just look at this briefly. The same, those little carrots will expand and you'll get more information about that. The ones that I wanted to touch on are, you do have to sign some forms. We'll get over this later, but something that's it's not allowable is you can't lobby with this money at all. You can't lobby with federal money. You can't pay for research and studies with it. You can't fundraise with it. For your agency, you have to use non-federal money to do fundraising, capital expenses, improving your building with, there are some exceptions to that, but for the most part, we can't, pay for buildings to be built, and things like that. So compensation directly for crime victims is something else that we can't pay for. Medical costs, there are some exceptions to that, emergency situations that we may be able to pay for some. And then other than that, I think probably the biggest one that I wanted to touch on, and we will talk about this later, is activities exclusively related to crime prevention. So that there are some exceptions with the prevention aspect of it, but we more like to focus on like we can pay for outreach and awareness. But when it comes to like preventing the crimes, we will get into certain exceptions with that. But for the most part, that's not something that we can pay for with federal money for VOCA. And Maddie, you can go back to the slides. The next slide pretty much just goes over the things that I just talked about. With that, I will turn it over to Mariah, I believe is next to talk about the VAWA.
Okay, so with the VAWA allowable and unallowable costs, a lot of it is very similar to VOCA, but I did want to highlight a couple of differences. So you may hear stop VAWA. So stop, what that means, it's the federal grant. There's many grants from OVW, but the one that we administer through our office is the stop VAWA funding. So stop stands for services, training, officers, and prosecutors. So that's going to tell you right there basically what that funding is allowed to be used for. So we have our victim services, we can use it for training purposes, and in our law enforcement and prosecution, we can fund specialized positions for investigators and prosecutors. So in addition to that, it's the 4 crime categories. So domestic violence, dating violence, sexual assault, and stalking. So those are the 4 crime categories that are allowable to serve those victims. And then when we're talking about allowable costs and activities, you'll want to be familiar with the federal purpose areas and the implementation plan. Those are going to outline what our priorities are for the funding, what it can be used for, what we expect it to be used for, and what we have reported to OVW, which is the Office of Violence Against Women, what we would be using that funding for. And then very similar to in addition to that, the activities are determined by statute, federal regulation, and policies. We also are bound by the DOJ financial guide and our certified assurances and grant conditions. So then, Maddie, if you want to click on that last link, it goes again to our website. So similar to VOCA, on VAWA, we also have at the very bottom, if you're a list person and you just want to kind of see, those are our program purposes. But if you want to go ahead and scroll down even more, the list of allowable and unallowable costs. So very similar. Some of these are different. OVW seems to be a little bit more restrictive in cost than VOCA at times. So you'll want to read through those. I'm not going to go through each of them, but this kind of will show you what is allowable and what the parameters of those allowable costs and activities are. And then while we're on the screen, we can go ahead and do the unallowable as well. So although you cannot discriminate and you can serve children, it cannot focus exclusively on serving the children. It has to kind of be as a primary or secondary, sorry. And then some of the same thing like public awareness campaigns, renovations. This one's a little different, not even like replacing carpet or painting. So not even just like the big capital assets, but even those small minor renovations are not allowed as well. For law enforcement equipment, such as uniforms, safety vests, shields, those kind of things are not allowable. Research, fundraising, those kind of things are pretty similar. So, and then again, the unallowable costs that are related to activities that compromise victim safety and recovery. So we went through this in the RFP, and there's also a slide, I believe, in the certified assurances that Tally and or Danette will speak about in a little bit. So I'm not going to get into those too much, but know that anything that prevents physical or emotional healing for victims, their safety, or allows offenders to escape responsibility, those cannot be supported with STOP funds, or in any case, the federal funds. And then I believe, Matt, if you want to go back to there we go. We can go to the next slide. I've already spoke about all of that. So I believe SAS might be next. Yes.
That is me. Good morning, everyone. My name is Melissa Wayment, and I am the Sexual Assault Funding Coordinator for our office. So I am going to start with SASP allowable costs. So the Sexual Assault Service Program funding is specific to providing direct services to rape crisis centers. There are 6 program purposes for SASP that are listed here. And in general, these should guide your agency in determining those allowable costs. These should be very familiar with for you, because this is how you developed your goals and objectives when you were applying. So if the accrued costs are in some way ensuring these services are provided within the context of rape and sexual assault, then it's generally allowable. It is important to remember, however, that the majority of the awards funds should be supporting direct victim services. So, for example, training staff and volunteers is an allowable use of a SASP-funded position, but it should be a small portion of the total program's costs. And as always, we would encourage you to check out the full list. So, Maddie, if you do want to click on that link, similarly, it will take us to our SASP allowable and unallowable. And so we didn't go over a ton of the allowable, but I would encourage you to look through this. SASP is technically under VAWA, and so you'll see a lot of similar general unallowable costs there as well. We can jump back. I've got a little slide on the unallowable there. So along with the general federal unallowable costs that can be reviewed in the certified assurances of your award, there are some specific activities that SASP cannot support. So training programs for allied professionals or the general public, activities that focus on prevention, sexual assault education to the general public, sexual assault forensic examiner or SANE programs, the support of a SART meeting. However, your staff can use their time, a SASP-funded staff can use their time to attend a SART. And then, of course, no domestic violence services that are unrelated to sexual assault. Okay, next slide. So as many of you know, this is the first year that UOVC has received state funding appropriated from the last legislative session to support victim services. And we're still learning and developing guidelines for this funding. We are fortunate that this funding comes with many fewer restrictions than our federal funding. So you can see that our allowable definition is quite broad. Each agency or program has a specific scope of work that was agreed upon when accepting your state award, and this should guide the allowable direct and administrative costs for that award. So especially in this first year, we expect to have many conversations with you state-funded programs to determine eligibility costs. So please don't hesitate to reach out because we're still learning and we want to help make sure that this is spent the correct way. There are some explicitly unallowable costs, though, that we can go over for state funding. So any services that are outside the scope of work or your approved budget, the purchase of land or real property, construction projects and physical modifications to a building, the purchase of alcohol, beverages, and entertainment of any kind, gifts or incentive awards, research, but that does not include needs assessments, any type of offender services, of course, food and beverage, but that is not including any emergency food that would be given to a crime victim, and then fundraising. Okay, next slide, Maddie. All right, so recently we have received some questions regarding the definitions and differences between these three activities: prevention, outreach, and awareness. So we felt it would be helpful to review the guidance that we receive from our federal entities as it pertains to each funding source. And so the language that we're going to give you here really comes straight from the federal rule or federal guidance from our analysts. Next slide. So first we'll talk about VAWA. We're going to talk about VOCA. Funding is primarily intended to fund direct services. So these services really should drive project funding, although projects may have some prevention aspects. The VOCA rule breaks prevention down into these three different categories. Primary prevention is intervention before a crime occurs. This would not be serving a crime victim, which is the purpose of VOCA, which makes this activity unallowable. So for example, teaching a healthy relationships class to the public. Now, VOCA-funded projects can have a primary prevention education component that complements or is integrated with victim service, outreach, or resources to victims, where the project has a substantial benefit to the victim. So, for example, providing a brochure to bring awareness of services, but also including warning signs of an abusive relationship, or providing a support group for victims that includes information on healthy relationships. So that's how it can be incorporated, and those are allowable. The second one, intervention, secondary prevention, intervention early in health and other impacts from violence and injury with the objective of preventing ongoing issues and working toward healing for survivors. This is allowable. An example of that would be a hospital-based intervention program that offers trauma-informed services to victims of violence to prevent ongoing violence while supporting survivors and communities in the aftermath of a crime. All right, and the third is tertiary prevention, is working with people already impacted and affected by violence and bringing in services and healing to assist survivors. So this would be allowable. An example of that would be something as simple as creating a safety plan to help prevent future victimization for the victim. And then finally, awareness and outreach, awareness and education presentations that are designed to inform crime victims of specific rights and services, and this is allowable. Okay, next slide. So SASP also requires that the majority of the funded project must go to direct services, which are those 6 program purposes that we just saw. Much of this SASP and VAWA guidance actually comes from a Q&A type style, so it reads a little bit differently. So SASP funds may not be used for activities focused on education and prevention efforts, so bystander intervention, social norm campaigns, or healthy relationship classes. That's unallowable. SASP funds may not be used for training to the community or allied professionals, nor may they be used to develop training curriculum. Sometimes when we think of outreach, we think of going out to an allied professional and assisting with training if they are to interact with a sexual assault victim. And under SASP, that is considered unallowable. SASP funds may be used for outreach to inform persons about the services provided by a specific program. For example, a program could use pamphlets, brochures, or community presentations to announce services available under that grant. Okay, next slide. Moving on to VAWA. In VAWA 2013, Congress added a new purpose area for developing, enhancing, and strengthening prevention and education programming to address domestic violence, dating violence, sexual assault, or stalking. However, no more than 5% of the state's total VAWA award for that year can be used for that purpose. So that means that the VAWA program manager, Mariah, has to review each of those requests that come in for prevention and ensure that overall it's not taking up more than 5% of her VAWA award for that year. VAWA breaks prevention down into two parts. Primary prevention means strategies, programming, and activities to stop both first-time perpetration, that's the first time we've seen that, and first-time victimization. Secondary prevention is identifying risk factors or problems that may lead to future domestic violence, dating violence, sexual assault, or stalking, and taking the necessary actions to eliminate the risk factors and the potential problems. And then they had a really great Q&A question here, so I threw that in there about outreach. What is the difference between prevention education, which is limited to 5% of that overall award, and outreach, which is more broadly allowable? And so they say the goal of prevention is to stop or reduce domestic violence, dating violence, sexual assault, and stalking. By contrast, outreach initiatives is linked to a specific set of services, and the goal is to increase awareness about the services so the victims know where to go. Okay, next slide. And finally, our state funding. So as mentioned, state funding gives us flexibility in what activities we can allow. So the definition we came up with was any prevention, awareness, outreach efforts that enhance victim services and supports the scope of work. I added in some of the definitions from the other federal funding sources, but essentially we're saying that any of those types of services will be allowable under the state funds. And while there is flexibility with these activities, we will still consider the priorities of the state funding for this year, which was to stabilize those core services to victims in each county. And this means that there should be a balance of direct victim services and prevention efforts within the award activities. Okay, so hopefully this was helpful going forward with your prevention and outreach efforts. Of course, if you have a project in mind, just reach out to your analyst and we can discuss further. And that's all I have. I think we're moving on to indirect cost next.
Good morning. I am Polly Rollmine. I am a state grant analyst and I do VOCA as well. I am going to walk us through indirect. We start by asking what are indirect. Many of you probably do not have indirect costs on your grant, and that's all right. And so you might not understand or know what I'm going to talk about really quick. If you do have indirect costs on your budget, then there would be a dollar amount in your grant budget. That dollar amount probably represents 10%, since most of our agencies taking indirect take the de minimis amount of 10%. Indirect costs apply to a small percentage of UOVC's grants, maybe only up to 20% of our grants, if that. And so because of that, and because we've already sort of gone over how to take indirect, and indirect gets approved in your budget when you're going through your application and stuff, I'm going to just sort of briefly touch on this, but please let us know if you have further questions. Some questions are more narrowly tailored to each grant program. So again, please let us know if you have more questions than what I'm going to cover today. Indirect is basically another way for agencies to be reimbursed for expenses. It's a way for costs to be divided up between agencies and for those costs to be allocated to certain funding sources. So very basically, I use the example of a house and the roof, where the roof is the indirect cost and it covers all of the other rooms in the house underneath it. Each room of the house may be a separate program, where one program might be victim services, one room might be fundraising, one room might be outreach. And so all of these rooms might not be direct victim services. And so we don't want just one room of the house to support the whole cost of that whole roof. And so we use indirect costs to split up the costs. Indirect costs are costs that are for a joint purpose that benefits more than one objective or activity, and costs that it cannot be specifically or easily identified to go to one type of activity. So these are also costs that are generally the overall expenses of managing or running a business. I mentioned that most agencies take the 10% de minimis. This 10% has been identified by the federal government as sort of a fair starting point that covers the basics of the overall indirect costs. Agencies can ask to negotiate for a higher rate if they would like. There is an application process involved where there's math and lots of back and forth about what your costs are, what's going to be covered, your activities, where they look at overall costs and all sorts of stuff regarding your agencies. And then there's some back and forth. It's called your cognizant agency that will negotiate the rate for you. And if you have questions about that, we can also help you with that. Examples of indirect are general administrative, salaries and benefits, facilities costs, legal and accounting. There's a little list here. I won't read them all. These are the expenses that an agency has to take care of, again, for the overall care and management of your whole organization. You must take indirect costs consistently across all your federal grants. This includes UOVC grants and other non-UOVC grants. So we are asking that you do take the indirect rate consistently, or that you use indirect consistently across all your federal grants, and that you follow your agency policy and procedure, and that you make sure that if you have a negotiated rate, that you are keeping us, UOVC, up to date, submitting that up to date negotiated rate paperwork to us. We realize that sometimes that paperwork doesn't even come till October, even though your rate has probably been in effect since July. But just keep us in the loop and send us that paperwork, and just follow instructions on how to fill out the billing ledger where you put your indirect rate, because the billing ledger has changed a little bit, and there is training videos on that where we do go over that change. But just a little FYI here, just make sure that your billing ledger has changed just a tiny bit in regards to the indirect rate, and that your indirect should not be any of the unallowable expenses. And then we can actually go to the next slide, where there are what's called administrative funds for your state grant. And they're the same, but not the same. Lots of this information looks the same on paper though. So what are administrative costs for your state grants? If you don't have a state grant, then this little tiny section is not applicable to you. But for those people with state grants who want to take administrative funds, they're akin to indirect: general administration, salaries, benefits, facilities costs, all of those same expenses that the agency would have to take care of the whole agency management and operation. Let's see. I lost my train of thought. Oh my gosh. For right now, in your state grant, administrative costs are not going to be separated out from the total in your budget or your billing. We moved that direction for a minute, but then we decided that we were not going to move that direction. So you may have gotten direction from your grant analyst that we were just going to combine everything. An administrative cost should be already approved in your budget. Like indirect, that should have already happened in your application process. These costs should be reasonable, allowable, allocable for the project. They should not also be any of those unallowable expenses that have been mentioned. Make sure that you can show the prorated formula for the cost of your administrative costs for audits, or if UOVC asks, just make sure that you have all of that information to be able to show your prorated formula. And I believe that we're going to hop over to match.
Tiffany, we can't hear you.
Let's try that. Can you hear me now?
Yep.
All right. So I'm going to go over the match requirements just briefly. Maddie, can you go to the next slide? Thank you. So for those that have VAWA, you're going to be required for a 25% match if your award was made to the courts, law enforcement, and prosecutorial agencies. For tribal, nonprofits, non-government victim service organizations, those match requirements are going to be exempt. I'm going to jump down to that last bullet point. For SASP, there is no match requirement. And for VOCA, there is going to be a 25% cash or in-kind match required for all federal funds. For those that are taking the match waiver, please start having those conversations with your agencies sooner rather than later. I know we just barely started the grant cycle, but when the match comes up in the next grant cycle, take a look at what 25% is going to look like for your agencies. Is it going to be in kind? Is it going to be cash? Is it going to be donations? What you can utilize. If your agency does not utilize the match waiver, just remember you're responsible for fulfilling all match requirements for the entire course of your grant. Make sure you keep your documentation so you can show it during any desk or site review. And this link that I have on here, Maddie, if you can click that. So this was something that was provided in a grant training that was held a couple of years ago, but it's actually really useful if you need it. You'll see that VAWA is listed on there, VOCA is listed, but it says 20%. So when you go, if you do use it, just select VAWA, and it's going to break down the amount that you will need for your grant. If you want to go ahead, and just give them a quick view of what that would look like. Kind of, there you go. You may need it, you may not, but if you're looking at what it takes to run your program and what federal funding you're going for, it's just a quick resource to use. We can go back to the slides. All right, if you want to jump to the next slide. So in-kind versus cash match, what does it kind of look like? So in-kind match is going to be like your volunteer time, building space. If your agency provides you with a vehicle, you'll need a KBB valuation. And those kind of things that kind of fit in with your program. For a cash match, those can be fuel purchases within your budget, vehicle leases, that's going to be cash match only. If in your budget, your agency is paying for training or travel that's not covered by your grant, supplies, utilities, internet, uniform allowances, that type of thing. So those would be considered cash match. And the biggest takeaway from those is that if you are going to use them as a match, make sure that you are keeping documentation so that when it comes down to a desk review or a site review, that you have all of that together and it's easy to provide to the monitors. Maddie, next slide, please. All right, so conditions of match. So your match must be met by the end of the year. Make sure that your match is in your budget. You need to be able to show it, as well as what is it? What is the source? Is it in kind? Is it cash? Make sure that that's documented within your ledgers. If you are using match, agencies should treat match just like federal money. So just like federal money, make sure you are using it for your VOCA valuable allowable activities. With your volunteers, if you're using them as part of your match, as your in-kind match, make sure that the activities that they are doing are allowable activities. Also, employees of your agency cannot volunteer time to be used for the purposes of match requirements. Maddie, next slide, please. Thank you. I think, oh, no, we can go back. Sorry, I just need to touch on a couple things. I had another slide. Just the biggest thing is consider the time and effort when you're looking at your matches and what you want to use in your grant and what you have already put in your budget. Consider the time and effort that it takes to provide that documentation for your match. Make sure what you are using for match is easy to bill for, is reliable, and that, like I said, you can provide the documentation for it. Especially if you're using building space, make sure you have fair market comps to be able to validate that space and that square footage. And those type of things. And so that's just kind of a brief overview of match. And then if you have any other questions, please feel free to reach out.
Okay, sorry about that. We look like we are running a little bit early, which I don't think anybody here would have a problem with. So we are going to, if it's all right with everybody here, forego our break and just go right into certified assurances for this morning, and then we can end a little bit early and get a longer lunch break. So certified assurances and grant conditions. The importance of this is something that we really want to bestow upon everybody here, because basically the entire training that we're going to be doing with everybody today is certified assurances and grant conditions. What we're going to be talking about in the next maybe 45 minutes or so on this portion of it is just some of the other certified assurances that didn't really need a full-on webinar or something else on them, but pretty much all of the webinars that you guys watched yesterday, some other things that we're going to be talking about today, they are all listed somewhere within the certified assurances. Many of the UOVC staff just mentioned those right off, but they are all in there. So it's important to know, like I said again yesterday, we're not making these things up. I'm not that creative, nor do we have a lot of the time to be putting all of these out there, but these are in the certified assurances. So once again, if you're like me and you're old school and you like some paper kind of things, and even if not, if you just want it on your computer, the copy of the certified assurances is on the website. You guys should all have a copy of it, especially if you signed it already. It was part of our RFP training back in the spring. Maddie, if you have a second, wouldn't mind putting that up, or if actually somebody from my team has a copy of that, can put that up in the chat. You can go ahead and have a copy of this right on hand to go through, because we will be, as we go through these certified assurances, you'll see at the top it might say, you know, B14 or A33 or whatever. Those aren't bingo numbers. These are actually referencing those certified assurances, and so you can follow right along. But I would highly recommend that all of the project managers read through the certified assurances at least once. Like I said, get your highlighter out, have those ready at any time, because this is what you're going to be monitored on. This is what the grant analysts are going to ask you for. And you don't want to come to people and say, I never knew that was a thing. And then it's right there in the certified assurances. So do yourselves a favor and be familiar with those if you are not already. Okay, next slide. Oh, yeah, that was what everything I just said. I do this all the time with slides. I don't remember where I'm at. So yep, you can access them on the website. If you or your authorized official haven't signed those yet, please make sure that you do everything you need to do to get your grant revisions all wrapped up and get those turned in so we can get your grant started and going. I think everybody wants to get that done. Okay, next slide. Okay, the first part under A2 in the certified assurances is the applicability of Part 200 uniform requirements. So basically what this is saying that there's a whole bunch of other requirements that are in the federal rule that apply to these awards. And it's in Part 200 of the CFR. There are links to that on the website. There are links to that on these slides. It is very long and we will not be going through all of that today. A lot of those are cost principles, for example, how you should be billing your grant and allocating time to the award and things such as that. Our subrecipient monitors, Wendy and Bree, will be talking about that a little bit more later. But that's why if you see an audit report and audit findings, sometimes it says this is in violation of Part 200 point whatever, because that is what we're going off of. So it's just important to note that even though there's like 50 pages of certified assurances that we have, all of those conditions that are in federal rule also apply to this as well. And then there are also several others, such as the VOCA rule, which once again is on the website. They talked about that a little bit more earlier today with allowable and unallowable costs and things of that nature. Anything in the Violence Against Women Act and the OVW Stop Act. And yes, we are getting out, it looks like there was sent out an acronym sheet. I remember we've had that in years past, and we were just reminded of it this morning. And so definitely keep an eye on some of these acronyms. As always, we forget that they're pretty common for us, but maybe not for everybody else. And so that will be available to you. Thank you, Maddie. Sorry to kind of put you on the spot there, but those are the certified assurances there. And like I said, if it's not printed out, just keep them on your computer because you do want to have these available and be aware of what is in them. Okay, next slide. Okay, requirements related to the system for award management identifiers, otherwise known as SAM. You should all know what this is, or at least somebody in your agency should know what this is. You can find it at www.sam.gov. This is where you need to go in your agency. You should all have this now because we've checked them all and we're required to check them, and use your EIN number and keep that information updated. Each agency has an expiration date that's separate, just depending on when you started putting this in there. And so you'll need to keep track of that, but we are required to go in annually and make sure that SAM is updated, and it's your responsibility to make sure that happens. So if you are not sure of what that is, ask around in your agency. Somebody should know because somebody is updating those. If not, we would have let you know by now if you don't have anything in there. Slide. And I'm going to toss this one over to Danette. She will be co-presenting with me, so take it away, Danette.
You bet. Okay, so like Tally said, her and I are going to be going back and forth on some of these certified assurances and grant conditions. The one that I want to talk about now is A9, and it is the restrictions on lobbying and policy development. You will notice this year, if you have already signed for your award, or if not, it will be coming. We sent out, this is such an important part of the certified assurances. And just like all of you, we receive feedback through our federal auditors. And this is such an important part of the certified assurances that this year, due to some feedback, we have asked all of the agencies to sign this as a separate policy as well, a separate form. So the restrictions on lobbying and policy development, federal funds cannot be used by subrecipients either directly or indirectly in support of enactment, repeal, modification, or adoption of any law, regulation, or policy at any level of government. And it generally prohibits funds awarded by UOVC from being used to pay any person to influence or attempt to influence a federal agency, member of Congress, or Congress. So if you're a person, and this has gotten a little bit fuzzy, and it's such an important part, we really want to stress it this year. This is a really good example of why for a lot of personnel, it's not a good idea to be 100% funded through the grant, so that you can have some time that's privately funded if you do a part of this for your job. Just know that if you do any lobbying or policy development and you're also federally funded, you should be keeping really careful time logs so that you can show if you do any of that, it's not done on federal grant funded time. Okay. The next slide, we're going to talk about non-supplanting. This is something that comes up frequently, and we talked about it quite a bit in the RFP, but the definition of supplanting is up here. And just, we want everyone to understand that grant funds are meant to supplement, not supplant. And federal funds cannot be used to fund things that would be otherwise available for, through other sources of funding. So it can't replace available state, local, or private funds. And this does apply to every agency that takes UOVC funds. This was very important for you to explain thoroughly in your budget justification as you wrote your grant. But we also want to remind you that through the process of maintaining your award, if at any time you are moving funds, or when you're talking about maybe changes in pay rates, that you are discussing that thoroughly with your grant analyst, and that is explained thoroughly. So if you're concerned or if you are changing anything around, please reach out and let's talk about whether your ideas to change funds would be supplanting or not. And this is part of the certified assurances that it is your responsibility to make sure that you always avoid. Okay, the next one we're going to talk about is another great one, which is under A19, and you are held responsible to maintain contact information. So that includes your key point of contact, your login information, and the program and the financial managers. We see that agencies are really good at that in the beginning, but turnover does happen. And we want you guys to alert us if someone is changing your position. Even we know that it happens a lot where someone leaves and there might be a period of time before someone else comes in. But in the interim, we need to have a contact within your agency, even if they're not going to be working on the grant, or maybe they're not even going to be in the system. We need to always have someone at your agency that we can reach out to and communicate with. So there's a couple of things that are just best practices. If your program manager is planning on leaving, let us know early on so we can help have a continuity plan with you to maintain this award, and walk the new person through the process of getting access to the GMS system and all the training that they're going to need to do to manage this award. There are two other important people that you should be keeping updated. We have, throughout the course of the year, some important announcements come out through our program managers, which you'll be getting emails if you're on book from Dale Euler, or from BAWA, it'll be Mariah Pease. And so if you're not getting their emails, we want to know who in your agency should be getting those important announcements. You can communicate directly with Dale or Mariah, or through your grant analyst. But we really want to have good information and communicate with you well. And just as a reminder, it's your responsibility as your agency to let us know when changes are happening. Okay, So this one comes up frequently as well. This is if on your grant award, you have any type of funding for, we see it frequently for brochures or flyers, or maybe some money or supply money that helps with your website development. Anytime that federal grant money is used, this publication disclaimer needs to be included in the document. And we, just to make it easy for you, we have it there, that second paragraph in quotations. That's exactly the wordage that you need to be having displayed on your written materials or your website or your billboard or whatever it is that you have used grant funds to purchase. And this is something that our desk review monitors are going to be following up on. And so if you have purchased brochures and during your site visits, they might ask to see those or see the PDF of those. And we want to make sure that this disclaimer is on anything that you purchase with grant funds. Okay, back to Tally. I'll do this next slide and
okay, sorry about that.
Oh,
sorry about that, you guys. My computer was blinking out on me. Apologize for that. Yeah, sorry about that. I'm back here. Let's go on ahead. Okay, so A24 audit requirements. So basically, if your agency spends more than $750,000 a year total in federal funds, that would include any of the federal funds that come through our agency, as well as any other agency that you receive federal funds from, then you will need to submit your audit reports to UOVC annually. And it must comply with OMB circular and be submitted to UOVC within 1 month of the completion of the audit. If you're not quite sure who to address that to, I can tell you right now, you can send it to our subrecipient monitoring manager, who is Wendy Winder. She will review those and follow up with you if you have any questions on those. Okay, next slide. Oh, and one thing, I do see a couple of questions coming in. We will be taking those and answering them along with the question and answer this afternoon. If you guys do have just kind of like a short question, like what did you just say or something like that, we can answer that in a moment. But if it's something that we need to get together with to provide a little bit more of a thorough answer, we will do that this afternoon. And you guys can still fill out the Q&A in that form that we sent out yesterday. That is just a fine way to do that so we can keep track of those. Okay. Oh yes, and use the Q&A tab in the Zoom. Okay, thank you, Dan. Okay, so B1, compensation and method of payment. This is obviously very important because everybody's here because they want to get paid. So you can opt to receive payment on a monthly or a quarterly basis once the financial status reports are submitted and approved. They do need to be sent in within 30 days after the end of the quarter or within 30 days after the end of the month if you choose to go with monthly. And then once they are approved and have all the allowable costs and things like that on there, I saw quite a few webinars about how to do that. Then we can get those sent out to you. The biggest thing that we need to make sure that everybody notes, we cleaned up this language a little bit this year. So please note that the funding under this award will be provided to the subgrantee on a reimbursement basis only after the payment request has been reviewed and approved by UOVC. And so we can't allow any expenses to be made and then, or I should say that, let me back up. We can't allow us to give you some money and then you can go buy the expenses. That's not how this works. You must have enough cash on hand to be able to make the expenses, and then we will reimburse you. If there is a very specific need for a subgrantee to have an advance, for example, maybe they're making a very large purchase and it's one time, you'll have to reach out to UOVC for prior approval, and that will be only exceptional circumstances and usually for something one time. So if it's something like I need to make payroll or ongoing expenses, it's going to be a no. These grants need to be reimbursement only. Okay, next slide. And Danette, you might just have to jump in and stop me because I can't see the bottom of my notes slide now if I'm infringing onto some of your slides, okay? Okay, B16, program director. We talked about this just a little bit recently about Danette saying that you needed to make sure that your project director is, the contact information is kept up to date. That is also very important. But I really want to once again stress the importance of having a project director. And if you don't know if that is you, then you need to make sure, because we only require and actually only allow one person in the agency to be the program director. You might have some other people that are helping the program director or also listed as backup points of contact. That is fantastic, and that's great to have more people involved in that. We would highly encourage that, but we do need just one person to be responsible for the grant so that when we have questions that we can reach out to this person. As it says here, this individual will be responsible for program planning, operation, administration under the grant agreement. The biggest thing I can say here is, I'll just be right out front. I saw Karen says I'm cleaning up my language. Probably not, but a little bit more for this particular training is that when it comes to your program director and reaching out to us, do not ghost us. Do not respond to us. It will not work out well for you. We all understand we get busy, and there are times when you can't respond for a couple of days because something is going, you've gotten behind, and that's fine. But we're talking about when we have subrecipients that will reach out to numerous times over the span of weeks, if not months, and we do not hear a response from. That is not okay. That's not going to work. We will be having stricter ramifications if we continue to see that happening. By taking on this funding, you are taking on responsibility to manage it according to these standards, and it is a pretty weighty responsibility. If you don't think that's something that you can do, you might need to reconsider your need for this funding, because it does come with quite a heavy weight to it. And so please do keep that in mind if you are selected as the program director. Okay, next slide. Okay, this we will be talking about a little bit more later on today in our subrecipient monitoring section. So I'm not going to go into too much detail about third-party participation, but this mostly applies to subgrantees that have some sort of contracted fees in their grants when they're requesting another party to come in and help them provide the services that they are receiving funding for under the grant. So like I said, it's more often than not, people have contract therapists, sometimes some contract attorneys, or maybe even interpreters. That is still the responsibility of the subgrantee, that the work that they are doing under there. So if something is going awry with your third party that is providing those services, it's going to fall back on the subgrantee. So you need to make sure that you are keeping those contracts in place, that they are up to date, they're following all the procurement standards of your county on the way that they are being administered. And also that we will need a copy of all of those contracts and agreements. Okay. Next slide. Okay, this is where I get kind of mean, but once again, I want to emphasize the seriousness of this funding that in the next two slides. Now, please keep in mind that terminating funding is never a decision that we take lightly. We have lots of conversations first, both internally as well as the subgrantees. Always the authorized official is in charge of that too. And so we don't want people to think, oh, you didn't turn in a report, funding is gone. So we never take this very lightly. However, it is on the table because we need people to take their grant funding seriously. And so please keep that in mind, that if you are not meeting the terms and conditions that we've been outlining today and in the webinars yesterday, your ability to receive funding could be in jeopardy. And on top of that, it might be, holding funds until we can get follow-up documentation of our concerns. You could be put in a higher risk level. There are quite a few levels of consequences that could be enacted should your agency not be following the certified assurances. While I say all of that, please remember that we are here to help you. We have, I know it might not feel that way sometimes, but actually we really want you to succeed. All of these grants were given out to programs because we saw an important need in your area and important work that you do for your service. And we would not have given a single dollar to anybody who was not doing that. So we want every single grant to be successful, but we also need all of these programs to be following the requirements necessary to do that. And so I can brag about the people here at UOVC. I think they're the best on the planet. Our grant analysts, as well as our subrecipient monitors, are here to provide the necessary assistance to help you have a successful program and a successful grant. Do not hesitate to reach out to them. They, I promise, are very patient and wonderful to work with, and are here to help you. Also, aside from that, like I said at the beginning of the day yesterday, we have a wonderful training and technical assistance team. They have great support and resources for you to actually provide the services and follow best practices and do that. So, like I said, we are actually here to support, to help all of you to do the best you can be. But unfortunately, if it does get to a certain point that that's not happening, we will take action to suspend or terminate funding. And the next slide. This is where it gets even worse, is that there could potentially even be criminal penalties if there's willful embezzlement, fraud, stealing. Don't go down that road. Knock on wood, we haven't quite had to do that yet. I don't know of anybody who's had to go to jail over misusing the funds, but no, that is out there. And on that same note, that person going to jail could be us if we do not administer these funds correctly and we are not doing it right. So that is why we are even more careful and responsible in our jobs if things aren't done correctly, because this is very serious. There could be a lot of problems. And so please keep in mind that if you do not feel like you're up to managing this funding, have some conversations with us and really take a look at that. Okay. Next slide, sorry. Okay. This one is just for nonprofit organizations, and this is actually more of a state requirement. If you're not aware of it, make sure you get on board right now, because this is something that's coming from our state auditor's office, that if any nonprofit receives more than $25,000 of federal pass-through state and local money. So I would imagine, I would have to go back and look, but I'm almost positive that every single nonprofit that we fund is over $25,000 in just one award. So I'm thinking this applies to about everybody, but if you're not sure, you can go to that link. Maddie, if you don't mind actually clicking on that for just a second. This will take you to the form that is provided by the state auditor's website. And you can go right in there and it will tell you, what category you fall under, what information you need to be giving them. And it even has a contact information at the bottom to reach out to somebody if you have questions. I did check it right before this training and I made sure we had the most updated form. So this should all be updated, but please make sure you're going and doing that in compliance with the Utah State Auditor's Office. Okay, back to the slides. Okay, and I know this one is back to Danette, so I'm going to turn it over to you.
Thanks, Tally. Okay, so this next portion of the certified assurances and grant conditions, I want you to think of more as a resource and a help to you. This is about the the federal financial guide that's put out by the DOJ. The financial guide includes information on allowable costs, methods of payment, audit requirements, accounting systems, financial records, everything that you'll need. It really does outline the successful administration of grant funds. So the link is hyperlinked in these slides, but it's readily available on our website as well to help assist you in the financial management of your grant. That being said, if UOVC determines that a current subgrantee has violated any of the requirements of the guide, they may be denied access to funding. So this is what we use. We ask you to use it, and it's just a very great resource. And so we please share this readily within your office with your financial managers, with people at all levels of your agency that need to know. This really is a great help to all of you. This next slide is about the finalization of contracts. So we're mid-September right now, and so we have until the end of September to have all of these contracts finalized. So that's within 90 days of the contract beginning date. So if we're waiting on you for something, please be timely in getting that back. And we really do work hard to get all contracts, all the final approvals and done by the end of the 90-day period. Okay, so this is what we call, it's under B34, and we often refer to this as cost principles, and you'll see a lot of acronyms. This really is the regulations and the rules that our desk review subrecipient monitors use. These are the things that you are audited on, and so we want to give those to you in writing, so you agree to comply with all of these things in the CFR. And this is kind of exactly where you can find the things we look at. And I know our subrecipient monitors use this frequently, and you'll see a lot of these little pieces of the CFR and the OMB quoted in your auditing reports. And so this is where we get them from. Okay, and then I just want to talk about category changes. This is something that we have really tried to stress with all of our subrecipients over the past few years, and we want to emphasize it today as well. So the things that you ask for in your grant are meant to be purchased and utilized during that grant funding cycle. So we ask that you plan and budget for equipment and supplies early on in your grant project to ensure the full benefit is purchased and received. Moving personnel, purchasing equipment and supplies, and requesting training funds during the last month of the grant may not be undertaken merely for the purpose of utilizing available funds, as this does not support the purpose of the program. So this is where program and grant managers are very vital in the management and maintenance of their grant. We want to see your staff attending those trainings throughout the course of the grant, supplies and equipment to be purchased early on and utilized during the course of the award. And this is, we have really tightened up. So about moving money and purchasing supplies during that last month, because we understand and we know that you do too, but it's very unlikely that you'll be able to use all of those supplies before the end of the award. So please plan ahead, look at your forecast of your funding and how you're going to spend it. Okay, this next B36 is about the Crime Victims' Rights Act. And the grantee understands that the purpose of this grant is to provide financial assistance to organizations that serve victims of crime, and that certain state laws exist setting a minimum level of rights for victims of crime. And it can be found in Title 77, Chapter 37, Sections 1 through 5. And the grantee further understands that all agencies who apply for and receive these grant funds must contractually agree to extend any and all rights and services that are required by law. This includes informing crime victims of remedies should their rights be violated, and the grantee understands the legal rights extended to victims of crime and will train all relevant employees and volunteers in those rights, and that you agree to comply with victims' rights laws. So the key component of this that I want everyone to focus on, I hope that everyone watched the the crime victims rights training yesterday and that you'll utilize that. But the part I want to really highlight for everyone is that you'll train all relevant employees and volunteers in those rights. So if there's only one person in your agency that is aware of this rule and only one person that's making sure that crime victims' rights are being upheld, that's probably not sufficient. So this is an ongoing thing. As new staff comes on, as there's change, we really want everyone to understand the rights of crime victims in the state of Utah. Okay, back to Callie.
Okay, I am a little bit more ready this time. Okay, on B38. Now, if you have a VOCA grant or even state funds, this is new for those grants. This information has always been a part of the VAWA and SASP grants, but we have recently incorporated it because we liked it into our VOCA grants as well. And so please do keep this in mind. This is new for VOCA grant subgrantees, and you might not be aware of it. It should not be that difficult of a lift for you to do, but you want to be aware of it. So the following are activities that compromise victim safety and recovery and undermine offender accountability. These are activities that you do not want to be doing, okay? Not activities that should be done, they're activities that should not be happening because they deter or prevent physical or emotional healing for victims or allow offenders to escape responsibility. Okay, so first, and some of these are pretty no-brainers, you know, I mean, it's fairly obvious, or they might be things you don't even really do anyway, like batterer intervention programs. But some of these might be something that you really want to take a deeper look into. You might think, we don't really have that policy, but maybe even informally, some people might be enacting some things that aren't really supposed to be happening. So like I said, just really take a good look at your policies and procedures on who receives services at your program and see if it could be better, especially on this first one already. This is talked about a little bit with our civil rights training, but we just really want to drive it home again. And the main emphasis we want to make on all of these is procedures or policies. You might have a rogue employee that does some things that probably aren't the best. That's probably not okay, but at the same time, you should have some protocols in place to discipline that should that happen. What we are going to be looking at is what your specific procedures or policies state. So, for example, if you have a specific procedure in your shelter that says we only house women and children under 14, and that is in your policy, that's no bueno. Okay, we need to look at that policy. Now, if there's a practice in your shelter that maybe it's not written down, but that you don't house men and children over 14, you might be sliding by, but that's still not going to work because you're still doing that in practice. So I want to clarify that just a little bit, because oftentimes we will reach out to programs and saying, hey, we have a concern. Maybe your shelter isn't providing safe shelter to male victims of domestic violence or transgender victims of domestic violence. And people might show us their policy or procedure that shows that they do that, but we're getting a lot of complaints that their practice is not doing that. And so just like Danette said, and I will reiterate again, these it is the grant managers, the project managers' responsibility to make sure that this information is going out to everybody in your agency that needs to know this. Because if you have a frontline employee that isn't aware of all of this and is just doing what they're told at 2 o'clock in the morning, then it doesn't make any difference if you've sat through this training and learned all of this. You need to make sure that this is being trained and this is being enacted upon, because that's the biggest thing that we care about. So anyway, let me read through the first one. Procedures or policy that exclude victims from receiving safe shelter, advocacy services, counseling, and other assistance based on their actual perceived age, immigration status, race, religion, sexual orientation, gender identity, mental health condition, physical health condition, criminal record, work in the sex industry, relationship with perpetrator, or the age and gender of their children. So pretty exhaustive there. but you really just can't have any policies, procedures, and I would say practices that discriminate against any of that. And the excuse of we don't have the funding for that would not work either. So say, I'm sorry, but we don't have any funding for interpreters, so we can't help a person that speaks another language. No bueno. Again, sometimes you can reach out to us and we can help with that, but you need to have reasonable accommodations in place about what you need to be doing. And so watch the civil rights training. Hildy will talk more about what those reasonable accommodations are. And this is what happens because I always just get going on a tangent and then I forgot where I started from. So I'll come back around to that one in a minute. Let's go to the next slide. Okay, procedures are policies that compromise the confidentiality of information and privacy of persons receiving UOVC funded services. We'll talk a little bit more about what the confidentiality is. But for example, if you have an MOU with a certain agency saying that, yep, we just share information so that we can work together and help the clients, and we share all that information, once again, no bueno, that's not going to work. Okay. Next one is more specifically for VAWA programs that offer perpetrator counseling. I don't think we have anything of that, but don't do that. Another one probably won't be too relevant to you all, but requiring mediation or counseling for couples as a systemic response to domestic violence or sexual assault, or in situations where child sexual abuse is alleged. Once again, I don't think that's happening too much. It's usually more of a courts issue under our VAWA programs, but just keep that in mind. This is a big one, requiring victims to report sexual assault, stalking, or domestic violence crimes to law enforcement, or forcing victims to participate in criminal proceedings. This does not apply to mandatory child abuse reporting. Obviously, we know that there is a duty to report that for anybody here. We get that. But saying we cannot help you unless you do A, B, and C, and you'll see report this. That is not a part of the services. Your services should remain the same no matter what, as well as forcing victims to participate in criminal proceedings. This is a question that actually came up in our RFP training. We want to address it again today. It is not your role, if you're here, to force victims to participate in criminal proceedings. If you are working as a system-based advocate, more likely than not in a prosecutor's office, if that is being imposed upon you as your role, then we would need to have some conversations with potentially your prosecution attorney and your program, because that's not your job. Your job is to notify, to inform, to support, to assist, all of those types of things, but to not force victims to participate in criminal proceedings. Those who are in these positions are keeping in mind that this is a victim advocate role and not a prosecutor advocate role. And so we just want to make sure that that's clear. I remember the other thing I was going to say on the other slide, Maddie, if you don't mind going back for just a second. See, I'm the only person that asked Maddie to go backwards. Okay. Just one other thing too, procedures and policy that exclude victims from receiving services. Sometimes, especially I understand this in shelters. I worked in a shelter for quite a long time myself. It is difficult. And then in other programs as well, you might have to be a little bit creative on how you're going to provide equitable services to everybody. And that's okay. We get that. But keep in mind that if you're saying, hey, look, we can't shelter men in our shelter just because it's small or whatever the dynamic it is, we're going to provide them a hotel room. That's fine. But you need to keep in mind that whatever the alternative that you're going to be offering to persons who don't fall within your categories needs to be equitable to be what they would be getting, even if they were staying in your shelter. So the same amount of time, food and support and shelter and things like that. And that shelter is obviously an easy one to identify there, but this really applies to all of the services that we mentioned, advocacy services, counseling, all of those types of things. So you wouldn't be able to say, hey, look, you only get 3 sessions with us because that's all the money we can afford for an interpreter. You know, you'll have to find someone else. You would have to give that person the same level of services that you would give to anybody that you regularly apply that to. That was what I was going to say. Okay, next slide and then next slide. Okay. Once again, this next one isn't too applicable to most of you because unless you're the court who we have had some conversations with, but court mandated better intervention programs. Yeah. So I'm just going to skip to the last ones. And this is a very important one to really look at your service provision, not just your policies and procedures, but also your practices. Supporting policies or engaging in practices that impose restrictive conditions to be met by the victim in order to receive services. Okay, we know this is kind of a tricky one because obviously resources are finite, be that shelter bed or money for housing, or even just your time and your availability to get into your schedule and things such as that. And so we understand that sometimes some requirements may need to be met in order to do that, and that's within your policies. But you really want to be careful when you're putting those together that you're not imposing those restrictive conditions on the victim in order to receive services. So one example might be, well, all clients that stay in the shelter need to be attending support groups 3 times a week in order to stay into shelter. That's very restrictive, and it's kind of requiring them to say, in order to meet this service, we get that. Now, sometimes we do understand that if a person, for example, you want to help them file a protective order, well, in order to file a protective order, you have to fill out a significant amount of paperwork. That's okay. That's just kind of part of the court process. That's not exactly a restrictive condition on in order to get a protective order. It's just what goes with that. But if you are imposing additional conditions to say, in order to receive this service, you need to do this first, not okay. Okay, next slide. I think, yep, that's it for me. I'm going to hand it over to Jeanette.
Okay, we are moving into section C, which we call special conditions. These are a little summary or highlights of the things that we reviewed before your agency got your grant the first time, but it's also the responsibility of your agency, your program manager, to make sure that you continue to uphold these grant conditions. So I'm just going to briefly go over some of these. It includes a history of effectively serving victims, and your agency needs to have support from non-federal sources. This has especially become important as we have lost federal funding and it has gone down. It really has highlighted the importance of having other financial support from other non-federal sources. So you had to have that to get the grant initially, but we ask that you maintain that and even push to continue to get more support from non-federal sources during the course of your grant. And that kind of highlights new programs with no history have to show they have about 25 to 50% of their financial support from non-federal funds. Your agency needs to be public, nonprofit, or a tribal agency that serves victims directly. Remember, that's a key component, is direct services to victims of crime. And that you will provide services at no charge through grant-funded projects. So that was a condition to get the award, and you have to maintain that. And so there might be a time someone new comes into your agency and says, hey, let's start charging people to come to classes, or let's start charging victims for protective orders, or let's charge for meals in the shelter. You have to maintain that all services through the grant-funded project are provided at no charge. Your agency needs to follow federal and state environmental laws and collect and maintain demographic data when voluntarily provided by victims. So I just wanted to highlight that one as well. It is your responsibility, but it cannot be a condition for receiving services. It should be voluntarily provided by victims, but is your agency's responsibility to do your due diligence to collect all demographic available information that is available. And that there will be no duplication of funds. So this is one that you have to think about as you're doing strategic planning and growing your programs, that you don't use, when new money comes in, that you don't use it to duplicate federal or VOCA VAWA SAS money that you're already using, that you grow your programs and are very careful about duplicating the use of funds. This kind of also crosses over into supplanting as well. And this is one that not everyone's aware of. Any computer network funded with federal funds must block all pornographic viewing. And for nonprofits out there, all of your financial statements must be available publicly online. That should be posted on your website, readily available for anyone in the public to review your financial statements. All programs must submit an equal opportunity plan, an equal employment opportunity plan, and make that available as well. And as a reminder, funds may be withheld due to outstanding audit or investigative issues. And the other one I just wanted to highlight is the restriction of non-disclosure agreements regarding the reporting of fraud, waste, and abuse of funds. So those are just some things under our special conditions we wanted to highlight that you can continue to maintain throughout the course of your grant.
Okay, we are rounding the corner with these certified assurances. Once again, just know that this is a very abbreviated version. We know that these are quite extensive. Oh, and one other thing I did forget to mention. If you have a state grant and you're looking through your certified assurances, you will notice that they are a lot shorter than what we have mentioned here. We made every effort to make sure that you don't have to do everything that is required in the federal if there's no need for it. And so we shortened those quite a bit if you are just receiving state funds. So make sure that you also pull those out. Pretty much everything that's in the state funding certified assurances is also in the federal certified assurances, but not the other way around. There's a lot of things that are in the federal assurances that are not in the state, and so you won't have to worry about those. So you will hear some things today, for example, the suitability to interact with minors, or you might hear them on a webinar for say, and like I said, that was listed out on the webinars, that not applicable to state programs. So the next three parts are just specific to the three federal programs. If you don't have those, you can take a break for a second. If you don't need to listen to that, that is just fine with us. But do keep in mind too, for just about all of the certified assurances, anything required, it is almost always agency wide. So for example, if we're going to be talking about confidentiality later on today, or when I mentioned just previously the policies and procedures that that don't ensure victim safety and whatnot, those are for the entire agency to be following, not just the grant funded staff. So do keep that in mind too. Okay. So the first section D is specific grant conditions for SAS. And this is just for people who have SAS funds. If you don't know what that is, then you definitely don't have it. Okay, some of this we already covered, so I'm just going to skip through. The use of funds for direct intervention and related assistance. Melissa talked about that this morning, that these funds can be only used for direct intervention and those specific categories. And then we also talked about the out of scope activities. So we are just going to skip right over that. Publication disclaimer, that is also in the certified assurances. We talked about that earlier, but just on page 34, it has the specific wording that you should be using if you have any publications under SAS. Number 4, requirements for recipients providing legal assistance. This does not apply to anybody with SAS funds. We don't have anybody using SAS funds for legal assistance, so I will skip over that. And then response to workplace-related incidents of sexual misconduct, domestic violence, and dating violence. There is a webinar on that. If you do not know what that is and you have SAS funds, then you need to make sure that you're looking over that. Next slide. Okay, the next one is for VAWA funds. So if you have a VAWA grant, then you'll need to listen up here. If not, then you can take a nap for approximately 5 minutes. Well, I don't know if it'll be that long, so be aware. Number 1, the VAWA 2013 non-discrimination provision. That's pretty straightforward, obviously, and we talked about that in our civil rights training Number 2, the public relations disclaimer, just talked about that earlier. Match requirement, this only applies to those who are not in the victim services category of VAWA. You should already be meeting that match, but if you have any questions, reach out to your grant analyst about how to do that. Requirements for recipients providing legal assistance. There are just a handful of programs that this applies to under VAWA. You have all filled out a form that you submitted with your grant application about what you should and should not be doing with that legal assistance in there. So just make sure that you are still following that and following the certified assurances on what that is. Okay, number 5, categorical exclusions. We did cover this earlier about unallowable activities under VAWA, mostly construction projects and renovation. So just keep that in mind. Number 6, court administration and practices. We only have one subgrantee, that is the court. So Amy, if you're out there listening to you, just make sure that you are following that as well. And then conditions specific to government organizations. We talked about this earlier as well, that you will not require a victim of any, sexual assault, domestic violence, or stalking to participate or force them to participate in the criminal justice proceedings, including filing a police report. And then also, if you are a subgrantee, that is a law enforcement agency, prosecution, or court, so any criminal justice government agency that is working with crime victims, that you also need to consult with your local community-based victim services programs as well, even if they're not VAWA funded. That is a requirement of this grant. We did have that as part of the grant application, that everybody had to fill out a form. So you should be good there, but you also need to continue to do that. And then just the same as in SAS, the response to workplace-related incidents of sexual misconduct, domestic violence, and dating violence, that is a whole separate training. You do need to make sure that you have that policy. This, by the way, is just a VAWA and SAS specific policy. We have not extended that to all of our VOCA subgrantees at this point. It's not a bad one to keep in mind, but if you do have SAS or VAWA, you need to have this in place in your agency. Okay, back over to Vint.
Okay, so Tally talked about specific SAS and VAWA, and I'm going to go over these things that are specific to VOCA. So some of the grant conditions that need to be upheld in VOCA includes utilizing volunteers. You may be asking yourself, if I have the match waiver, do I still need to be using volunteers in my agency? And the answer is yes. The match waiver reduced or removed the administrative burden of having them on your budget and having to go through the process of showing that through your desk review, but your agency still should be using volunteers whenever possible. However, we just want to mention that waivers for the volunteer use, it is possible to get one. If it's impossible for your agency to utilize volunteers, talk to your grant analyst about that, but that is something that really needs to be addressed during the grant award process or when you're writing your grant. But volunteers are vital to VOCA. And the next thing that is specific to VOCA is the SAR. And the SAR stands for Subgrant Award Report. And it happens at the beginning of your grant cycle. And we will be sending you out instructions on how to complete your portion of the SAR. The SAR is very vital because as you're doing that, you can kind of see how it breaks down the percentage of how much money you're getting and the percentage that's used for each individual crime victimization, how you're projecting the use of funds. And that helps us make sure that VOCA funds are distributed throughout crime categories equitably and meeting our minimum requirements there. So the SAR happens at the beginning of your grant, and then PMT, which stands for Performance Metrics Platform, or sometimes we call it the Performance Measurement Tools. It helps report back to UOVC the number of victims, the types of crime, and the demographics of the people that you are serving. PMT reports are due quarterly throughout the entire life cycle of your grant, and they are done in the federal grant system. And those are really important to report because it's managed federally. So the thing I love about the PMT report is the number of victims you're serving at your agency is added to the number of victims that are served in the state of Utah. And every state across the nation is doing that same PMT report that you're doing. And so federally, VOCA can see across the whole nation how many victims are served, how they're being helped, the demographics for those people. And it really helps guide how VOCA funds are being administered and make sure that different states are utilizing them and different agencies are utilizing them effectively. And it helps identify gaps in services and different populations that we need to be seeking. So I love the PMT report, and there is some great trainings on that as well in our all of our YouTube that came out yesterday. So please make sure that as you do your PMT report, you understand it, you're doing it effectively, you're gathering that information on a daily, weekly basis so that the information you put into the PMT can be as accurate as possible, because it really matters. And then the last one is compliance with the Victims of Crime Act. And I talked about that a little bit earlier, and we have a link here that can help you with that section as well. Okay, the next thing I want to talk about is the Rape Crisis Counselor mandate. So the Utah Office for Victims of Crime requires all nonprofit organizations receiving grant funding who provide rape crisis services to certify their compliance with the Confidential Communications for Sexual Assault Act. And that is a Utah specific code under Code 77. All subgrantee staff and volunteers who provide direct services to victims of sexual violence must complete the 40 hours of training in assisting victims of sexual assault. The training to certify as a rape crisis counselor must be provided by a Utah Rape Crisis Program or the State Sexual Assault Coalition. So as I read that to you, I tried to kind of highlight some important parts of that. This applies to nonprofits who are rape crisis centers and who are providing direct services to victims of sexual assault. This is a great law in our state, the Confidential Communications Code, because it gives you added protection that can protect you and your agency from being subpoenaed or forced to testify or provide information that is confidential about a sexual assault victim. So it is kind of twofold. It gives great training. It helps make sure that your agency is aligning with best practices and trains staff on an ongoing basis, but it also protects the rape crisis counselor from having to disclose confidential information. If you are a nonprofit providing sexual assault services, it is vital that your new staff undergoes this training right away, like at the earliest possible time that they can receive this training. It's vital that they do so. Okay, back to Tally.
Okay. Last one for this morning. And this is new again for this year too, and it is applicable to all of our grants, VOCA, VAWA, SASP, as well as our state programs. So please pay attention to this. Is the privileged communication with victim advocates mandate. We require all nonprofit and government organizations who receive grant funding and who provide direct services. So if, for example, you're a court, I'm sorry, Amy, if you're here, once again, we seem to pick on you a little bit easier because that's not a direct services grant. This would not be applicable. But if you provide direct services in your grant project that you are complying with the Privileged Communications with Victim Advocate Act, the actual statute is referenced in your certified assurances there. You can go to that. And also grantee staff and volunteers who provide direct services to victims of crime must complete 40 hours of trauma-informed training in crisis response, the effect of crime and trauma on victims, victim advocacy services and ethics, informed consent. And this part, we're referring to the statute regarding confidential communication. And the training must be approved or provided by UOVC. So I can tell you right off of the bat that the training that is provided by the Utah Coalition Against Sexual Assault, the one that Danette just mentioned, the 40-hour rape crisis counselor training, as well as the 40-hour training provided by the Domestic Violence Coalition, do satisfy this requirement. So even though we did just talk about the 40-hour training for rape crisis counselors, if you are a program that serves rape victims, a nonprofit, and that you do that for your staff, then it satisfies both requirements. You don't need to attend a 40-hour rape crisis training and then attend another 40-hour training on top. You're welcome to do that, but that satisfies both. This is definitely more applicable to programs that might not need the 40-hour rape crisis training, but that are also serving victim services, also serving crime victims. So a lot of system-based advocates specifically, as well as maybe other programs that don't necessarily serve rape victims. We do offer a Victim Assistance Academy 3 times a year through our organization. Like I said, both the Domestic Violence and Sexual Assault Coalition also offer 40-hour trainings that do satisfy this requirement. And there are a few other trainings that we list online. If you have a specific training, or maybe you came from another state and you already have this or whatnot, you can reach out to us, more specifically our training coordinator, Rochelle Hill, and we will look that over and see if it will satisfy this requirement. But you do need to make sure that all of your employees that are providing director services, as well as volunteers, do meet this requirement, and that you do have that documentation on hand should that come up in a desk review or site visit. Okay, that is all for this morning. Selena, by the way, I do see your question in the chat, in the Q&A. If you wouldn't mind actually throwing that into the Q&A form that we've sent out, that'd be really helpful, because I think you were asking at a certain point in the training, and now we're not entirely sure what that was referring to. So if you don't mind putting that into the online Q&A, and then we will get to that this afternoon. Also, if any of you have any other questions about some of the information that we covered today, or any of the recordings that you were watching yesterday, please submit that into the Q&A, and we will look at that for this afternoon as well. On that note, it looks like we ended quite a bit earlier than we had planned on, so that's always nice. But we are going to stop now because we want to start up our afternoon session at 1 o'clock in case there were anybody that's planning on joining us for that session. So it looks like we'll have quite a bit longer for lunch than we intended. That's great. You could use it to catch up on some webinars or whatever you need to do. And we will meet back here at 1 o'clock. Thank you, everybody.
So, Maddie, are you sharing the slides for me?
Yep, I'm pulling them up.
Thank you. So I'm Wendy Winder, and I am one of the subrecipient monitors here at UOVC. Those of you who have been with us a while probably remember us calling ourselves auditors. We didn't really love that. It didn't really fit exactly what it was we were doing. And so we have changed our language a little bit to more appropriately describe what it is that we're doing. So we're going to talk about monitoring for a little while today. Hopefully you guys can stay awake after all of the carbs I'm sure we all ate at lunch. But we're going to talk about the purpose of grant monitoring to start out. So Matt, if you want to move forward, thank you. So the umbrella purpose of monitoring is to ensure reasonable compliance with regulations. There's a hierarchy of requirements that must be adhered to, and the first is Congress. Then there's the CFR, state regulations, certified assurances, the DOJ grants financial guide, and of course all of our internal policies and procedures. So another important aspect of monitoring outside of ensuring compliance is to assess the internal controls to help prevent any fraud, waste, abuse, or misuse from happening. So often agencies are not aware of the gaps in their controls until something goes wrong. Our hope is that your internal controls are reviewed regularly to address new factors that might be presented. Policies should be updated regularly. If you have policies that the last version is from 10 years ago, it's probably time to have a discussion about getting those updated. So a financial documentation review includes any federal or state dollars that are reimbursed to an agency, as well as any in-kind or cash match. It'll include things like allowable and non-allowable costs, non-supplanting, proper documentation, contracts being followed, and things of that sort. Performance management is a review of the non-financial aspects of an organization. So this could include policies, your non-discrimination, EEOP, language access, things of that sort, complying with certified assurances, your performance reporting, meeting your goals and objectives, just basically all of the non-financial aspects. And then technical assistance is an important part of grant monitoring. So it can be done in many ways by many different staff positions at UOVC. Monitoring can be done by your grant analyst or by our trainers, just in a less formal capacity. So if you're ever unsure about something that you think you might benefit from getting some additional help on a topic, just let us know. We're always here to provide any assistance that we can, answer the questions before things go wrong. So the formal grant monitoring through UOVC is done through the desk reviews and the on-site monitoring, and we'll talk about those in depth a little bit later. So let's go to the next slide there, Maddie. So let's talk about the annual assessment that we have to do, and I put there the CFR reference up there that compels us to do this review or this assessment. So every year we assess every agency's risk using an objective list of questions that OVC and the VOCA Center have helped us create. So every agency is assigned a level of 1, 2, or 3 based on the outcome of that assessment. The minimum frequency and type of grant monitoring we do is prescribed by UOVC's policy based on the assigned level. So if there are extraordinary circumstances, that level might be moved up a level. So we might bump you up to a higher level, but we don't move those down until the new grant cycle and a new assessment is done. So that's basically what we normally call the risk assessment. It just kind of helps us guide how often and what type of monitoring we need to do. So then next we'll talk about desk reviews. So every agency will have a regular desk review based on their identified level. Occasionally, we'll also request backup documentation for financial billing that is separate from your regular desk review as part of a random sampling, or if concerns are raised about one of your billings or someone expresses a concern. And sometimes we just randomly pull an additional quarter for an agency just as part of our own internal controls. So one part of the desk review is financial and the other is programmatic. The purpose of the financial review is to ensure that reimbursement requests are allowable, allocable, necessary, reasonable, and have adequate supporting documentation. Allowability is based on the type of grant that you have, which is approved in your budget, and the federal rule and UOVC policy, what those things allow. So if you're ever unsure about the allowability of an expense, please ask before you bill it. I just lost my train of thought. I hate when I do that. Gosh, my goodness, you guys. Okay, so let's talk about each of the standards a little bit. So allocable means that it's being distributed equally among the available funding sources. Well, not equally, but according to the correct percentage based on the funding or the use. So for example, if you're billing for the purchase of a computer, that computer is going to be used for VAWA work about half the time, and for unallowable work the rest of the time. You should be billing VAWA for half of the computer. But if everything being done on that computer is allowable, but the staff person using it is only 50% funded by VAWA, you could still bill the full amount of that computer if it's approved in your budget, because the full use is supporting the grant funded program. So allocation happens most often in the salary and benefits. As far as the regular billings, there's a short training video on allocation and fringe benefits that will provide more in-depth explanation of that, so I won't go into that too much. Meeting the necessary and reasonable standards is based on what the average person would think. So consider the amount of funding that you have and what the main priorities are. If your funding is so tight that you can't retain enough staff, consider whether or not it's reasonable to pay for an out-of-state training or to buy new furniture and decorations. If a victim needs a fridge to move into their own place, do they need a new $1,800 fridge, or could their immediate need be met with a used like $300 or $400 fridge that still works well. So it's just considering based on your circumstances, what would be considered reasonable and necessary for that particular item. So last, we need to ensure that sufficient documentation is kept for all financial outputs. Everything you purchase should have a detailed receipt. Contracted fee invoices should be detailed enough that you can identify what service was provided, what the rate that they're being paid is, what client it was for. Doesn't have to be necessarily named on the documentation, but there needs to be an identifier so you can tie it back to ensure that what you're being billed for is appropriate for the client. Emergency funds that are used to pay for client utility or phone bills need to have detailed copies of the bill, not just a summary of what was owed. Rent payments need to have current valid leases that show what is due and when and what the total amount covers. So for example, if a client owes their landlord $2,000 for next month, is all of that $2,000 rent, or is some of it late fees, utilities, pet fees, things of that sort? With the utility bills and the phone bills, we see things like streaming services, games, things of that sort that are not allowable. So those are the things you'd have to check that bill for and make sure that you don't bill for anything unallowable on there. So I can't express enough how important it is to keep your documentation organized and easily accessible. So if we ask for it, you should not have to do much work at all to get that information to us. Keep it all in one folder and all in one place. So all you'd have to do is drag and drop that into an email or into a Google file or however it is that you want to send it. And it shouldn't take much of your time at all to provide the information we need for the review. Your information that you send us needs to be detailed and clear. We should be able to clearly see what invoices and receipts belong to which category. If we get the whole, drop a box of receipts on your accountant's desk, we're probably going to send you back an email saying we need this sorted for us. We don't have the time to try and sort through that, especially when we don't know what's supposed to go into what category. So you would, for personnel records, you need like a copy of timesheets, a payroll report, a benefit report. Those are things that are probably going to have to be run before you can bill in the first place. So if you just save a copy of those at the time that you bill, then you'll have those available as well. You won't have to go back looking for them or running new reports later. So keeping things organized will save you a significant amount of time when we ask for that documentation. So let's talk about the programmatic side of desk reviews. Programmatic reviews are also a part of the annual review. So the specific things we review may change from year to year, but there are a few things that will always be kept up on, some things that we're always going to look at. So we're tracking policies, and I'm sure you all are well aware of all of the policies we've been working on getting everybody into compliance with. And I think Tally talked a little bit earlier today about the importance of that and the reasons why we're doing that. So each year, so we are tracking now. So if we have received a policy from you for a certain topic and we've marked that off as sufficient, then we don't necessarily need to ask for that again the next year, but we will probably ask for updates. So have you reviewed your policies and done any updates to them? And then we might ask for a new policy. We might pull a new topic out of the certified assurances and decide to check on the policies for that year. But this most recent year or two is by far the biggest burden when it came to those. We've got the vast majority of things in place, and for the returning agencies anyway. And so things should be a lot smoother going forward. So the standard subjects that we look at are the financial management, personnel management, contractor and consultant policies, travel and training, equipment and supplies. So some of those basic things. Recently, we've been talking about things related to the certified assurances and working with the requirements that are being expressed to us by our federal oversight as being the ones that they're focusing on and the most important ones to them. So record retention, breach of personally identifying information, confidentiality, the dreaded determination of suitability, then the workplace related incidents of sexual misconduct, domestic violence, dating violence, and stalking for those VAWA and SAS grants, and that was covered earlier as well. So certified assurances, A24, and then the 2 CFR 200-501 requires that any agency expending federal funds in excess of $750,000 in a fiscal year needs to have a single audit completed. Tally again touched on that earlier, so we won't go into that too much. but just letting you know that that is something that we ask for in the desk reviews. We also check the Federal Clearinghouse every January and July, because we have 6 months to reply to any relevant audit findings with a management letter. So we check those twice a year. If we don't happen to get a single audit from you one year, we don't find it in the clearinghouse, we'll probably just shoot over an email saying, hey, was this something that you were supposed to have done? Was it done and we just can't find it? So we'll just clarify. And if you didn't need to do one, then you just let us know that. So all VOCA grants require the submission of a federal report each quarter called the PMT report. I know that there's been a lot more detail go into that as well, so I'm not going to talk about it too much. But that PMT report, your progress goals and objectives, things of that nature are also something that we're always going to be looking at, either during the formal desk review, or it might be something that the grant analysts look at a quarterly basis. Like they may track your goals and objectives to see how you're doing in that way. And that would also be considered a form of monitoring. So we request the supporting documentation for your report. We compare the documentation to the report that was submitted, and we look for accuracy as well as reasonableness of what was reported. So let's say you're a domestic violence shelter, but you report a large number of SANE exams on your PMT report. So that would be something that we would follow up on, because that's not a service that's generally provided by that type of provider. So things of that nature. We're also closely checking this year that clients are being offered the assistance with the CVR referrals. So make sure that that's something you're offering to all clients. It is a requirement for the VOCA grant specifically. And then civil rights compliance, it's another area that we will be reviewing on a regular basis, something you can expect us to always keep up on. So let's move on to on-site monitoring. On-site monitoring is also a federal requirement, and the frequency of that is determined by that annual assessment. So the purpose and type of the site visit you receive might change from year to year based on the identified needs. We generally do the same type of site visit for all agencies, unless there's like a special circumstance. New agencies might have some different information that we go over with them just because they're getting up and going. So things might change a little bit. We have a lot of discretion related to the site visits and what we do with those. There are a few things that the VOCA Center has identified as best practice and the main purposes of site visits. So the first would be technical assistance. It's a great time to sit down face-to-face with you, answer your questions, talk about best practices, try and help you come up with ideas to solve barriers that you're facing. And you're always welcome to reach out to us by phone or email, but we like to have this opportunity to sit down and have conversations about some of those things. So we're also expected to look at your location where the services are being provided. We don't need to go and look in every closet and every corner, but we will ask for a walkthrough to see, where the magic is happening, where it is that you're providing those services. And during that walkthrough, we'll usually verify your supply and equipment inventory for the grant purchased items from the last 3 years. So if you purchase a non-disposable item with grant funds, even if it's only partially paid for with grant funds, you need to track that item and on an inventory. And then when we come out, we'll have you pull out that inventory and go around and show us where each of those items is, or let us know if it's not in use anymore, what happened with that. So some years, but not all years, we'll spend some time talking with staff who are not necessarily managing the grants, but are working on the grants. We'll talk to them about the program, assess their knowledge of their goals and objectives, allowable, non-allowable, the tracking requirements, things of that nature, to see how they feel things are going and what their understanding of the program is. So it isn't something that they need to be worried about. It's not like there's some type of penalty associated with it if they don't know these things. But what it does is it gives us an idea of technical assistance that we can provide to them, information we can give them, or feedback we can give to you about some areas that might do them some good to get some training in. So it's really just to give us an idea of how involved the staff are and what they know, and then can we provide any assistance that way. So the last thing that the VOCA Center suggested as a good use of site visits is relationship building. We all know that maintaining that strong professional relationship with good communication will make things go a little more smoothly. But those relationships obviously aren't going to happen without effort. You don't know us that well a lot of the times, and we don't know you. And sometimes it takes some time to build enough trust to build that relationship. So sometimes at our site visits, we might just spend some time getting to know you, We want you to feel comfortable with us, understand our style and our intentions and what it is that we're working towards. Usually people feel a lot less anxiety about monitoring events if they have gotten to know us a little bit. So please feel free to use this time to express any concerns, present ideas that you have, tell us what's working well for you. We're open to feedback and suggestions. We've made several changes over the last couple of years because of suggestions from subrecipients. If we can reasonably do things to lessen the burden on you, we will, but please understand that sometimes we just can't make the changes that you're suggesting, that we're trying to maintain consistency. So changing the rules for one agency and not others is not something that we generally do. So let's talk for just a couple of minutes about the common areas of concern. So this is things that we find agencies most often have errors related to. And we tend to see the same type of thing from agency to agency. So we want to keep these things on your radar, something for you to watch out for and try and avoid these mistakes before they happen. There's a few categories that we'll talk about. There's lack of supporting documentation. This is actually becoming a lot less common in the last few years. Agencies, you're all doing a really good job of tracking your documentation, and problems with this is getting more and more rare. So we're really excited about that. But some of the things we most often see with lacking documentation is missing leases for rent payments, the utility bills that don't have the breakdown of the charges. Let's see, so gift cards is a big one. So keep in mind that if you choose to utilize gift cards, we still allow the use of them, but you can't bill for the gift card itself. You can bill for what was purchased with the gift card. So you can keep gift cards on hand that your agency purchases, use those gift cards to buy something that you need for clients or even your own supplies, whatever it is, and then you can submit the receipt for that purchase, but we will not reimburse for simply gas or for simply gift cards. And the reason for that is that gift cards can be used for a lot of unallowable reasons. It's hard to track, what they're used. Even if a gas station, you give a client a gas station gift card so they can get fuel, they can still use that gift card in the store, and they sell unallowable things like tobacco and alcohol. So there's a lot of ways to avoid using gift cards these days, but if you choose to use them, just make sure that you don't bill for them without attaching the receipt for what it was used on. So salary and benefits being inaccurately billed, we see that happen for a couple of reasons. Most common reason is just due to a misallocation. So with salary, some agencies still apply paid leave to the funding source arbitrarily. They don't do it based on the allocation of work time. They'll just say, we have extra funding in this category or in this funding source, so we're going to bill all the leave to that. And that doesn't work. So if you bill, say 80% of the time that an employee worked in a billing period was for, say for the VAWA grant or for the SAS grant, then you can bill up to 80% of their leave time for that same period. But you'd have to bill that other 20% to the programs that were supporting the rest of their time. And that's the same thing for benefits. It happens the same way. I think we've had a separate video on allocation of benefits. So again, we won't talk about that too much, but just keep in mind that if you bill a certain percent of somebody's salary, you can bill up to that same percent of their benefits for the billing period. So the last thing to keep in mind in this category is that when an individual leaves employment, when their employment is separated, any of that leave paid out needs to be done according to your policy and should be billed in the benefits category rather than salary. And again, I think Bree covered that in the benefits video, but I just wanted to mention that as well because that is something that we see more often than we would like to. Okay, so continuing on with common areas of concern. So the information on this slide is really only relevant to agencies with federal grants. If you are state grants only, this won't really apply to you as much. Most agencies with federal grants have been utilizing a match waiver for the last couple of years, but it will come back eventually, and some people are still using it. So I just want to mention a couple of things here. So with match, keep in mind that the documentation and allowability requirements are the same if you're using match or if you're getting federal dollars to reimburse. There's no difference. What's allowable with federal dollars is the same that's allowable with match dollars. So keep that in mind. Sometimes we'll see some confusion on that. Let's see. Vehicle and space costs are another way that people tend to miscalculate their match on. So if you own a building, or if you're renting, then you can use the actual rent that you're paying. If you're not renting the building, then you need to take the comparable lease value. So somebody mentioned earlier about getting some comparables. That's not difficult to do. There's several websites where you can do that for free. You don't need to pay anyone to do this for you, but you just need to find similar spaces in your area. Sometimes in the rural areas, you have to call your area a much wider area to find some comparables, but just find out, how much square footage per year is going for in your area, and then multiply that by the number of square feet that you are claiming as match. For vehicles, you can use something like Kelley Blue Book or the NADA to get a value on the vehicle. Make sure that you're running that value like on an annual basis when your budget renews, because cars obviously depreciate and you want to use an updated value. You don't need to be doing it every quarter or every billing. Once a year is sufficient, but just make sure that you remember to do that update. And then you can bill the full amount of that car's value over the 2-year budget period. But keep in mind that if you do that, then you can never use that vehicle as match again because you've already claimed its full value. So you can do that, or you can break it up into more of like a monthly payment type of match. So space costs, let's see, we talk about that. Let's see, what else can we talk about? Match documentation, often we see issues with timekeeping. So requirements are the same again. So everyone on the grant, including match individuals, must keep daily timesheets. That includes volunteers. When we review timesheets, we need to be able to tell the total hours that were worked in the billing period per day, and how many of those hours per day were devoted to grant eligible activities. So that's both hourly and salaried employees. Even if your agency does not require you to keep a timesheet, you still have to do it for purposes of the grant. If your name is on the grant, you need to keep a timesheet, no matter what type of coverage you have on that grant. So last couple of things, programmatic concerns that we see quite a bit. One of the things we're seeing a lot is people not keeping inventories of their grant-funded supplies and equipment. We talked about that requirement, but that is something we're seeing quite often, that people just don't have an inventory. And that will be something that comes up on your monitoring reports. If you don't have that going, the last 2 cycles we've talked about it. We've been telling people about it at desk reviews and site visits for at least a couple of years. So if you don't have that, please get it going now. Most common concern that we identified last year for all findings, but especially for programmatic, was related to the accuracy of the PMT reports for the VOCA grants. Our best advice, save a copy of the data that you use to create the PMT report, double check your numbers before you put them in, or have somebody else do a double check to make sure that they're coming up with the same numbers you are. If you don't save your data and somebody enters something after the fact, when we ask for that documentation and you run a new report, the numbers are going to be different. And whether they were right at the time or not, we can't show that. And so that would be an area of concern on your monitoring report as well. So let's see, I promise we are getting close to the end here. All right, I know this next slide, people will laugh, how to have a relatively pain-free monitoring experience. It is possible, but we know it's always going to take a little bit of time. But it is a non-negotiable requirement for all agencies receiving UOVC grants. We do have some suggestions to make it a little more efficient. Ask questions when you're unsure of something. So it's a lot easier and faster to ask a question that, about something you're unsure of before you do it, than to try and explain it and correct it later. So new situations are going to come up. Please feel free to reach out and talk to your grant analysts or to Bree and I. We're always happy to help with that. Most important thing you can do to save time is just make sure that everything is documented. Never put anything on your billing request that you can't look at the documentation for. Again, I can't express enough how much I wish people would just save all of their documentation in one place. I'm always surprised when it takes somebody 3 or 4 weeks and 10 hours to find all the documentation for one billing. That should all just be in one spot. So it would be really quick. You're pulling that information together anyway in order to do the billing in the first place. Put it where it needs to be, and then just drag and drop that file. If we ask for the documentation for a particular period, pay attention to the grant period. So like which quarter we're asking for, as well as the grant year. Something new that you will see in these upcoming years is that instead of doing just the open billing cycles, we'll also be reviewing for past billing cycles up to the last 3 years. So that tends to be the national standard. We were at a training recently and found out that we were the only state present who does open reviews on open grants instead of on the closed grants. So just double check your work, make sure everything's there. And when we ask for information, just check the fiscal year on there. So let's see, keep track of which documentation corresponds with each billing category. Make sure that you're familiar with the grant terms and conditions and the certified assurances. That was talked about earlier as well. There's a lot of information, but catch the highlights, look through them, make notes about the things that are most relevant to you and your position. Often these are only sent to your authorized official. Some of the people who are actually managing the grant never see them unless they go looking for them. So just remember they're in the GMS and they are on our website. So the last thing I suggest is self-audit. So you should occasionally have someone spot checking what's being done in the program. You can have somebody from one program doing spot checks of the work in another. If every quarter someone reviewed the documentation for just 1 or 2 areas, you'd learn a lot about your strengths and weaknesses and how to avoid mistakes. For example, 1 quarter you could have somebody review your contracted fee invoices for accuracy, or your program plan goals to make sure that they've all been updated and entered correctly. The next time you could have someone review the timesheets, do a review of how your LEP program is going. So just do some self-auditing. It doesn't have to take up a lot of time, but if somebody just does some spot checks here and there, you will learn a lot. You'll be working towards best practice. You'll fill in those gaps for internal controls, and it's going to save you a lot of headache later on down the road. Okay, so somebody earlier covered the reporting fraud, waste, and abuse certified assurance, so I'm not going to spend a lot of time on it here, but we are going to go over a few certified assurances in the next couple of slides, so try and stay awake. So this certified assurance, again, it just says that if someone has credible evidence that someone has committed fraud, waste, or abuse, they must report it to the Department of Justice Office of the Inspector General and to the UOVC right away. If you're ever unsure about something that you're seeing, reach out and let us know. It's okay to say, hey, this is happening. I'm not sure if it's okay. We can talk it through with you and help you make a decision about whether or not it's something that you need to report to the Office of Inspector General. And it's okay to come to us with something that we say, you know, that's really more of just a practice that's maybe not a best practice, isn't necessarily something that needs to be reported, but feel free to reach out and we will talk through those things with us. Your employees should have, everybody who's working in the program should know who they can reach out to other than just their direct supervisor, because this direct supervisor might be the one doing the things that they're concerned about, but they need to know who they can reach out to talk about concerns that they're seeing, things that they might actually be becoming fraud, waste, or abuse. So transparency, willingness to make necessary changes, those are the most important factor. If something does go wrong, let us know. This happens more often than you would think. We've had several agencies in the last couple of years come forward and say, hey, we found this is happening in our agency. We know it's not okay. And they all still have funding and they're all still working with us because they were transparent and they were willing to make the necessary changes. So just keep that in mind. And then outside of the fraud, waste, and abuse, we have misuse of funds. So this is when something is happening that doesn't necessarily rise to the level of fraud, waste, or abuse, but still not an appropriate or best practice way of handling things. So these are some of those maybe less egregious actions. misuse, a lot more common than the higher levels of fraud, waste, and abuse, obviously. These are still issues that need to be addressed, especially right now. We do not have the federal dollars to be misusing funds. It's just, money is so tight right now for everyone that it's just unacceptable to be misusing the dollars that you are getting. So if misuse of funds is identified, there's several potential outcomes. Those are all set out in the CFR, including those that are listed here on this slide. However, those remedies are what we could use if we could not rectify the concern through corrective action. We're always willing to work with you. These things are very, very rare. Almost always we can just sit down with someone and say, hey, we've found out that this is happening. We don't think it's the most appropriate way to be doing something, and work with you to fix it. These things are something that are so rare, and it's the kind of the worst case scenario. So work with us. I can't say enough. Transparency, and be willing to work with us, and things, we won't really be facing any of these items. So let's see. Enough about all of that. We'll talk a little bit about maintaining records. This is one of the policies that we were asking for in this last year to make sure that everyone's policies were in line. So and your certified assurance is B11, maintenance of records, and then certified assurance is A29, auditing, monitoring, and evaluation. So in these certified assurances, so it says all documents pertinent to grants or their associated contracts must be kept for at least 3 years after the close of the grant cycle, that they will be available and that they will be available to us for us to review when we request them. So that's kind of the gist of these two certified assurances. If you've had grants with us in the past, keep in mind that that these things can go back we can review things for back to that 3 years. You are required to keep your documentation for those 3 years. So just make sure you have everything in line and that those things are all readily available. Let's see. That's it for maintaining records. Hopefully, I think just about everyone has got that policy. Everyone that's returning anyway has got that policy in line. So that shouldn't be something that's difficult for you to make an adjustment for. So we'll briefly touch on certified assurances B18 and B9 related to releasing information to the UOVC. Part of accepting a grant is agreeing that the UOVC or the OVC must be allowed access to all documentation related to grant funding, including information from contractors. With that being said, we are acutely aware of the need for confidentiality and protection of PII. We will respect that as much as possible. When we ask for documentation for a review, please do not send us any information that has anything that has the PII on it. Please redact those documents before you send them to us. That applies to both employees and clients and those victims. So if we receive information that has client names or identifying information, we're going to delete it and request a redacted version. We won't save those into our files. As soon as we identify that that's the case, we're going to delete it from our system. We never need employees' home addresses, social security numbers, birth dates, other private information. Those things have been sent to us. That again is something that we're going to delete and request redacted versions of. We don't want to be responsible for that information, and I seriously doubt that employees would want that information out there as well. So unless we specifically ask for personally identifying information, please do not send it. If we need it, you will know exactly what we need and why we need it. So those are extremely rare if they ever happen, but you will know if we need any personally identifying information. So we're going to talk about purchasing. I'm sure you're done listening to these monitoring topics, but I want to just spend a few minutes talking about purchasing because it is something we're going to be focusing on this year. Especially related to contractors and consultants. So the most important thing to remember is that a lot of agencies have been under the impression that because a cost is covered by the grant, that they can make a purchase or contract with somebody without following their agency's purchasing or their policies that way. So travel, supplies and equipment, contractual agreements, personnel costs, all of those are things that you have to follow your internal policies on. For travel, two things to consider. Is it in your budget and is it in line with your agency's policies? If you have travel rates approved in your budget that are higher than what your agency's policy allows, you still can't bill the amount you approved in your grant because it's more than what your agency policy allows. Supplies and equipment need to be purchased the same way that they would be done if you were using another funding source or through a general fund. As long as you follow your procurement and purchasing policies, you should be fine with that. And then last, I want to talk about these contractual agreements, because we are diving in deep on these. So if you have contracted fees, please listen up. All contracts you enter into for contracted fees need to have a current, detailed, signed contract. It needs to be very clear what the contractor is expected to deliver and what the payment for those services will be. It needs to be dated. It needs to have an expiration date or a renewal date. Needs to be renewed before you make any more payments on it. So if a contract expires after 2 years and they send you an invoice for a month after that contract, even if you plan to renew it, you cannot make payments or bill for payments on that contract until it has been properly renewed. You need to have contracts filed with the appropriate department within your agency. This isn't something that you can just keep on your own computer or in your own files. If you contract with an agency to provide some type of service with your grant funds, let's say your audit department is the one who normally maintains contracts for your organization, they should have a copy of that on hand as well. If you leave the agency, we should be able to go to that department and get copies of any of those contracts. Before you make payments assigned to handle those contracts, have that on file with the appropriate department. Before you make payments on invoices from your contractors, verify that they are billing for eligible services at the correct rates. Don't just assume that what they send you is right. Contracts and invoices should be professional and clear. It shouldn't be somebody handwriting on a piece of paper that I saw 5 clients this month, so you owe me this much money. They need to have professional, clear documentation, and just keep in mind that we will be reviewing. If you have contracted fees, we're looking at your contracts. If you don't have contracts in place, please get those in place. If you need help with that, let us know. But it's going to be one of our primary focuses this year. So some final thoughts. Here's where, as Tally said earlier, I become the bad guy. Our agency has had some discussions among the administration, and we want to put out a friendly reminder about a few things when it comes to management of the grants. So all grants require work, we know that. However, some grants require more work than others, and the federal grants through UOVC do tend to require a bit of effort. When the UOVC releases an RFP, or when we establish conditions on that funding, that is the UOVC establishing the services and terms that we are offering to purchase. So we're telling you, what are we willing to purchase? And what are the conditions for those purchases with the grant funds? If you do not or cannot provide the specific services we're offering to purchase under the terms that we're offering them, you don't have to apply. But we will not negotiate on the services we're offering to purchase or the terms under which we will purchase them. If we ask for insight and input on these matters, that is when we will take comment on them, but not after the RFP has been awarded through our allocation process. CFR, so 28 CFR section 94-103 establishes that state administrating agencies have sole discretion to determine which organizations will receive funds and in what amounts. If you have received a particular type of grant from the UOVC in the past, that does not entitle you to receive those funds again. Each RFP is a standalone offer, and agencies should never assume that they are entitled to receive the same type of funding or any funding at all, or a similar amount to what they've received in the past. If you're awarded a grant under a new RFP and it's not the full amount you requested, it's not for the same purposes that you've received in the past, you can choose to accept it or not, but it's not negotiable. Please take some time to think about the amount of work it takes to manage the grants you choose to apply for. If you are a returning agency, you should have a good idea of what that looks like. Consider that burden compared to the benefit that you've received from the awards and decide whether or not the administrative burden is worth the value being added. I think most of you will find that it absolutely is. If you decide that you can meet your needs with other funding or that burden isn't worth the added value, you can let your grant manager know and we can close or reduce your award. Make it fit your capacity a little better. If you choose to keep the award, there's an expectation that you fulfill all of the requirements without pushback, excessive complaining, or arguing about it with your grant analyst or other UOVC staff. We greatly value the services that your organizations provide, which is why you received an award. We genuinely hope that you'll decide to make these grants work and continue partnering with us moving forward, but we want to set clear expectations up front. The UOVC staff constantly look for ways we can reduce the amount of work it takes you, but there is a minimum that will always be significant if you have chosen to accept multiple awards and large awards. The more awards you receive, the higher amount of funding you request, and the number of staff you choose to include in your budget will all naturally increase the amount of work it takes to manage. Consider these things carefully when looking for ways to reduce your own burden related to the management of your awards. We do not expect you to like everything you're required to do to manage your award, but if you choose to accept it, you're choosing to follow the requirements. If you make that choice now, there should be no reason to address it again during the grant cycle. With that being said, we do always welcome ideas on how we can improve so long as they're presented in a respectful manner. UOVC employees will not be expected to put up with communication that is rude, demanding, or demeaning, that is passive-aggressive or bullying, and you can expect the same in return. If you choose to communicate in these inappropriate ways, please be prepared for a response from the UOVC. These things have gone unchecked in the past, but that will not be the case moving forward. Lastly, we expect timely communication and timely submission of required documents. If you receive an email or a voicemail from a UOVC representative, we expect you to respond within a time frame that is accepted in a professional setting. UOVC policy allows a certain amount of time to complete tasks and submit billing requests and performance reports. If you are late on these items, corrective action will likely be taken. Please prioritize these non-negotiable deadlines. The majority of agencies we have worked with in the past have not had a problem with any of these things that I've covered in this section, but with the new cycle, we want to be very clear and upfront about our expectations. We're striving for best practice, so some of the things that were overlooked in the past will not be accepted moving forward. And that is it for me. I hope you were all able to stay awake. Thanks for your time.
Thanks, Wendy. Appreciate that. She just gave us a bunch of great information. We really appreciate the work that Wendy does. She's really helped us come a long ways with getting up to par with monitoring our grants and making sure that everybody is moving forward and doing the best they can with their desk reviews, how we manage the money, how we track. So I'm very appreciative of Wendy and Bree. This program has come a long ways with them. So with that, this is the last section that you guys actually have to listen to us rant on for. Hopefully this part doesn't take any more than 15, 20 minutes to get through. We're going to be talking about confidentiality. And this is something usually that I'm sure you guys have heard Mariah do this training a bunch. But I think Tali said that y'all might be sick of listening to her talk about this. So they put me in. But yeah, let's get to it. The confidentiality provision we have at UOVC, the VAWA and SAS citation is the 28 CFR 90.4, and the VOCA one is the 28 CFR 94.115. I am joking, Tali. I'm sure everybody would rather be hearing Mariah right now than me. So if you go to the next slide, we're just going to talk about some general information first. Next slide, please. So what is the UOVC confidentiality provision? It requires all of our sub-grantees receiving our funding to protect the confidentiality and privacy of persons whose sub-grantees are providing services. The provision is designed to ensure the safety of adult, youth, and child victims of crime. So this is you might see VAWA a lot in this, and this initially came from VAWA, and we are adopting it as a UOVC policy for our federal awards. That's something that I'd like to stress too. This is for our federal awards that we give away through UOVC. So if we go through our next slide, I better open my chat because I think Tali's coming after me now. Okay. Yes, thank you, Tali. So what does it mean to be covered by the UOVC confidentiality provision? Subgrantees covered by this provision may not disclose, reveal, release personally identifying information or individual information collected in connections with services requested, utilized, or denied through grantees and subgrantees programs. regardless if it's been encrypted, hashed, or otherwise protected. Next slide, please. These guys. So what is personally identifying information, which you might read in here as PII, or I might refer to it as PII moving forward. So it's information that may directly or indirectly identify that individual. It may disclose the location of the individual, such as the name, the address, other contact information, social security number, their race, their birth date, perhaps the number of children that they have. And it may also include information that is encoded, encrypted, hashed, or otherwise protected. Next slide, please. So what are some circumstances in which the subgrantees may share PII? So the first one that we talk about is when the victim provides written, informed, and reasonably time-limited consent to the release of information. So we are all here trying to help victims, trying to empower victims. So it really is the best for them to have control of what they want to release, how long they want to release it for, and them to have the option to say they no longer want to release this information. Other instances may be when a statute compels that information to be released, or when a court compels or orders that information to be released. If the statute or court compels the release of information, the subgrantee releasing the information must make a reasonable attempt to provide notice of the release to the affected victims and take the steps necessary to protect the privacy and safety of the persons affected by the release. Sometimes you might lose contact information. They may lose their cell phone. You got to make some efforts though. If you can't get a hold of them, you got to try an email you have. You got to try a letter maybe if you have something like that, but there needs to be some reasonable attempts to try to contact them if the court is ordering for this information to be released. Next slide, please. So each of our agencies has a requirement to report actual or imminent breach of PII. Each agency should have written procedures in place to respond in the event of an actual or imminent breach as defined in the OMB M17-12. If one, it creates, collects, uses, processes, stores, maintains, disseminates, discloses, or disposes of personally identifiable information. Sorry, that's a lot. And then in the CFR, within the scope of UOVC grant-funded program or activity, uses or operates a federal information system. The subrecipient's breach procedures must include a requirement to report the actual or imminent breach of PII to a UOVC program manager no later than 24 hours after the occurrence of an actual breach or the detection of an imminent breach. So we've had these happen before, and we've had some agencies do some really great things. They took some appropriate action. They kind of got all hands on deck, and they notified us, and they gave us the step-by-step process of what happened, how they addressed it, what's going to be happening moving forward. And then it also just depends on the type of information that was leaked, who it went to. The nature of the situation may vary from case-by-case basis, but we do need to be notified within 24 hours. Next slide, please. So this section will talk about the scope of the provision. Next slide. So the scope, subgrantees, MOU partners, and other partners are covered if they're receiving funds under the grant as subgrantees. So partners that do not receive UOVC funding are not covered by the confidentiality provision. However, OVW, OVC, those are the federal agencies, and then UOVC us encourages such partners to voluntarily opt into the requirement of the provision because it's best practice to keep our victims safe. So not only helping them, keeping them safe, keeping their information private, those should be, our main priorities. Next slide. So here's a couple of questions from the frequently asked question list, which we'll have linked at the end, but these are some common ones that we've fielded before. So what if the subgrantee is a large umbrella organization, but only one division of the organization is providing grant-funded services? Under the provision, the division of the organization that is providing grant-funded services may not share personally identifying information with other divisions of the organization. An example of this would be a organization that it could be a shelter that has a counseling program and a food bank. If the client comes to the shelter, the shelter would need a release from the client before the shelter may contact the food bank on the client's behalf. So even though it is the same organization, if there's different departments, different arms of that organization, you need releases to go in between those. Next slide, please. Can a victim service division or component of an organization, agency, or government share information with the leadership of a large organization, agency, or government? An example would be the executive director of a shelter or the CEO of another agency. In absence of a statutory or court mandate or release from the victim service division may only share identifying information about victims in extraordinary and rare circumstances. Such circumstances would not include routine monitoring or supervision of that program. So we still need to keep that private, even from our executive directors and our chief executives. An example that they provided would be allegations of fraud against the victim service division or one of its staff members as being an exception to this. Next slide, please. The provision applies to all operations of the victim service provided or victim services division component, even if the grant funding is only for a small part of the operations. The provision does not cover any identifying information about the offenders. So this is only covering our victims. It's not covering the offenders at all. And if we are funding a small part of that operation, this provision applies to that. However, our SANE programs and SAFE programs are not covered under this provision, but they are subject to other things such as HIPAA. Next slide, please. So here is a caveat, and we do have quite a bit of victim advocates working for police departments and prosecutors' offices. And this is the way that the VAWA offices at OVW interpret this. So victim witness assistants at police departments and prosecutors' offices are not covered by the provision because they are not providing victim services. Although the services you are providing help victims, you guys might also be required to assist with the investigation and prosecution of the case. And then this came from one of their legal counsels, this next part, Marnie Shields. Law enforcement and prosecution-based advocates are considered victim witness assistants rather than victim services, so they can share information with law enforcement or prosecution entity they work with. They should just be upfront with the victims in terms of informing them that services are not confidential. So this is their interpretation of that. I hope hopefully all of you guys that are working for police departments and prosecutors' offices, hopefully that's one of the first things that you say to the victims that you meet with upfront, who you work for, what your role is, how you can help them, but at the same time, the stuff that they share with you is going to be shared with the prosecution. It's going to be shared with your investigators, just so they know and they have the chance to maybe not speak with you if they don't want to speak with you. But just so they're aware of what's actually happening, especially in a time of crisis and trauma. Everything moves quickly. Next slide, please. So let's talk about the releases a little bit. Next slide. So what criteria must these releases meet? They must be written, informed, reasonably time limited, and signed by the victim. Subgrantees cannot use a blanket release and must specify the scope and limited circumstances of any disclosure. So, that's one thing. If it's a court case and those things can take a year or 2 years, they cannot sign a release for the entire 2 years of the court case. There needs to be a limited time on that. And then you'll see an example that we have that you could have a box for them to extend that time for whatever you would consider reasonable. At minimum, the subgrantee must discuss with the victim why the information might be shared, who would have access to the information, and what information could be shared under the release. Reach agreement with the victim about what information would be shared with whom, and record the agreement about the scope of the release. So again, empowering them to choose what is going to be shared, what is not going to be shared, and how long they want it to be shared for. And then also letting them know that anytime they can call you up and say, hey, I no longer want to share my information. Next slide, please. Reasonable time period will depend on the specific situation. It's hard for me we can't give you like a concrete answer on what that would be. It's on a case-by-case basis based on the situation. So it's hard. It just has to be reasonable, and that's what the language says on the federal level. If you're signing for a minor child, the parent or guardian must sign the release with the child. Consent may not be given by the abuser of the minor. And if the minor is incapable to sign, the parent or guardian may consent on the minor's behalf. If you have a legally incapacitated person, it must be signed by that person's legally appointed guardian. And also, consent may not be given by the abuser of the legally incapacitated person. And then finally, like, this is one important thing to stress, is the subgrantee may not require a victim to sign a release as a condition of receiving services. It must be voluntarily and fully informed. But in no instance should you ever say you have to sign this release for me to provide you services or offer you services at all. Next slide, please. The statute does not allow for oral releases. A written release is required. So if you are speaking to a victim over the phone, or they're calling into a hotline or something like that, if they give you verbal permission as a release, that does not count. You have to have something in writing. So what options do you have at this point? You can have the victim remain on the call while the third party is contacted, so the victim can provide his or her own information without the need for a release. Or you can have the victim email or fax a written release in, stopping the conversation at that point, saying, hey, we need to get this done, having them fill out and sign a release, and then email, fax it, scan it, however it needs to come back at that point before you move forward. And Maddie, there should be a link here at the bottom called Victim Release Sample. And this is something that we've provided. Let's see. I don't know how well they can see this. Can we zoom in on that a little? But if your agencies don't have access to something, which probably most of you do have releases already, here is just a brief example, giving a disclaimer at the top, who they want to have their information, what information is going to be shared about them, why they want their information shared, giving a disclaimer and what they understand. And then the important part right here, the release expires on this date and this time. Then they sign it. There's a place for a date and time and a place for a witness as well. And then that bottom box is what I was talking about earlier, the reaffirmation and extension. So if the release ends, you can get it on the same form where they can extend it and they can sign it again. They can give the date. They can have a new date and time when that is extended to. Again, you guys have access to these slides, and that link is there for you if you need something to go on. So this next part, we added in new this year to this training, and this is confidentiality and telework. If you go to the next slide. So there's nothing here that I'm trying to mandate or say that you have to do. These are just things to consider since telework is more prevalent than ever since COVID. I mean, I know that our office and this group of people that you're seeing today, we used to be in there 4 days a week, 5 days a week. And now that's kind of flipped and we're home 3-4 days a week and we're in the office 1 or 2 days. So, but we all have this reduced expectation of privacy when we're working at home. Your significant others are around, kids, family members, people stop by. In the communication that you have with your coworkers or your supervisors, or if you're speaking to a victim from home, that stuff is just, it's not as private and personal as it is if you're working in an agency that's locked down, so to speak. So some things to consider is, make sure you're using a VPN if you're on your laptop. You might have a secure office and printer at your home that could be locked, secure filing cabinets, work cell phones that are secured, that are separate from your personal cell phones. So thinking about these things, and consider updating your policies and procedures if you haven't. I know a lot of you have, to account for the telework that's going on, the work from home that's going on. Just take a look at your policies and procedures again. Make sure that you're addressing it, thinking about it, because our expectation of privacy is greatly reduced when we're working at home. Next slide, please. So this next section, we're going to talk about the confidentiality acknowledgement form, which I believe we had everyone sign last cycle. If you go to the next slide. So all subgrantees are required to acknowledge that they are aware of the confidentiality requirements imposed by this provision. We need your authorized representative with UOVC funding must sign the form as part of their grant conditions. So we are checking with the feds on this to see if we have to send this out again this year, or if they will let us just count the award packages that you guys have mostly signed at this point, count as this. So you will hear from us again in the near future about if we have to sign this form again or not, which Maddie, there's a link for that at the bottom if you'll click on it. If it will come up, yeah, you can just scroll down. This is their form. There should be a place for your authorized official to sign at the bottom. So we may be having to send this out again. As I said, you'll hear from me, Mariah, Melissa, Polly. You'll hear from us about this. Sorry, not you, Polly, because this is only for our federal money that's required. But yeah, you'll hear from us shortly about this. Okay, if we go to the next slide. So yeah, this is it for this section. I think I did it in what, 25 minutes or so. So here's some links to additional materials. A lot of this was based off of the FAQ on the frequently asked questions on the VAWA confidentiality provision link you have here, but I've also leaked the citations for the VOCA CFR and then for the VAWA and SAS CFR about the confidentiality provision and the non-disclosure of confidential or private information. So I think, do we have anything I can address in the chat? So it does look like we do have some Q&A here. This is it for the confidentiality portion. Maddie, if you go to the next slide, I think this is the part where we are opening it up to question and answer. And I think, Tally, jump on if you will, but I think this is where we'll open up our cameras and the whole team will come on.
We're actually going to take a break. Oh yes. We are going to take a break because we've gotten a few more questions come in. And so we want to make sure that we can chat before we, sorry, I am just so spaced out lately, so I apologize for that. But we want to take a break before and chat about those before we jump into Q&A. So if we could take 15 minutes, that would be lovely, and come back at 2:20.
Thank you, Tally.
Here. So we received a handful of questions, both in the Q&A on here, as well as the form that we sent out. So if you don't see those, we will be putting those into the Q&A ourselves, just because obviously you wouldn't see the questions that were sent in on the form. So the first question that I want to address, I'm just going to go through some of these ones that are more specific to me. And I'm not quite sure if I'm not quite sure how much these have been put in yet. So I will just read it out loud. The first question I see here is, how regularly do staff and volunteers providing direct victim services need to complete the required 40 hours of training annually? And the question actually is just once, according to the statute. It's just that one initial 40-hour training, keep those certificates on hand. And so even if you did it 20 years ago, it would still count. And of course, we would still encourage ongoing training, but the requirement under the statute is just that once. Okay.
Tell me which number you're going to next, Tally, and I'll copy it onto the chat real quick.
Let's see here. This is the longer one. It looks like Bree's already on it too. That asks about confidentiality and making recordings.
That's a long one, sorry.
It's okay. Okay, hang on.
It's a certified assurances one, right?
Yep. Okay. So it says here, actually, no, I'm sorry, not the recordings. In the certified assurances, this makes a lot more sense. It reads that we cannot engage in practices that impose restrictive conditions to be met by the victim in order to receive services. That's the one I'm referring to. Attending counseling, seeking an order of protection. What if our services are primarily counseling and we ask that participants in our program hold counseling sessions in order to attend other activities or live in a transitional house? For example, Our program includes financial planning for those who live in the transitional house so they can work towards finding their own home. If the survivor refuses to attend therapy and financial counseling, they aren't really a part of our program other than living in a house, so more like a tenant than a program participant. Yes, I'm wondering if I can read the requirement, as we are not allowed to require outside services in order to participate in our services. Okay, so this is coming from my portion of the presentation that talked about you cannot impose restrictive conditions on clients in order to receive services, or you cannot make services mandatory. This is kind of a gray area and gets pretty tricky, I can understand, in certain situations. Because there are certain programs that a lot of you I know have that aren't exactly restrictive. At the same time, in order to receive benefits from the program, you might have certain criteria they need to fulfill. We have consulted with OVW. We have had a lot of conversations on this matter. And what it really comes back to is what is overall best for the client and for their needs in that situation. So for example, sitting down as a case manager or even as a therapist and making a plan for them that is tailored to fit their needs and whatever that action plan might be. So if that is financial counseling or job searching or support groups, having those provisions in place, on a case-by-case basis, and then following up with that client on an individual plan is okay. Because we do understand that certain program might have their criteria. The bigger concern we have is when it's more a list of certain services and certain hoops that the client has to jump through in order to receive a service, especially when those restrictions are more placed as a blanket policy for all clients and not looking into the individual needs of each client and where they might be. For example, with our housing programs, we know a lot of you guys receive Housing First funds. And the main goal of that funding has been Housing First and flexible funds. And so not to impose a laundry list of restrictions that clients need to do in order to receive funding. But at the same time, understanding that, once again, resources are finite. So if you have one person that's in the transitional housing program that might not be making the most progress, and that means other people who could be in that program are not utilizing that space. So we do know that there's some kind of wiggle room in there, but we also want to make sure that it's not a blanket policy and procedure is what we're coming back to in your agency to require a long list of services. But as always, if you have more questions along those, please feel free to reach out to us, reach out to your grant manager, because we know that there can be some area in there that gets difficult. Okay, let's go into, okay, I'm going to start at the top of our questions in here. Okay, Tiffany, this is going to be your question, so I'm going to put you on the spot, and I'm just going to go ahead and put this right into the chat. And the question is, since I am in a rural area and I cover initial response and the beginning of the court process, this is technically 2 case numbers in reporting, and I'm assuming this reporting on the PMT, would it still be counted as 1 new person or 2?
All right, so if this is in respect to the PMT report, okay, so when you go in to do that report, you're going to list them as 1 individual, okay, because down as you go into the PMT report, it's going to ask you how many new individuals. So you're going to count them once. But when you go into your services, you'll be able to count, your crisis response, as well as your court advocacy as well. So it doesn't mean you can't add those services, but you're just going to count them once.
Okay. All right. Let's see, the slide for title. Oh yes, we have answered that question specifically, so I'm going to skip that one. Okay, the next question, and it looks like Bree is getting these questions in here for us. I'm going to read it while that's coming in here. And actually that one is answered. Okay, we've had this one, Dale and Mariah, by the way, you're on deck to answer this question. We've had 2 questions come up recently regarding confidentiality and would love your guidance. Under Utah state law, a phone conversation can be recorded as long as one person is aware of the recording. Can a hotline call with a case manager or advocate be recorded and then later used for training purposes within the agency? Can conversations between a clinical counselor and a client be recorded by either the therapist for training purposes or by the client for future reference? Do either of these situations break VAWA confidentiality issues?
You want to take the first one or the second one, Mariah? You're on mute.
You can go ahead.
Okay. So for part 1 of this question, I would say that you still need to have a release at the very minimum, but I still don't think that that's enough in this kind of situation. You shouldn't be recording. Let me just double check that again and read it. Let's see here. Where are we? Okay. Yeah, I don't think it's appropriate at all to record a conversation and then use that for training. Even if they do sign a release, there's not going to be a limit. There's not going to be a limit there that they can put that, hey, yeah, you can use this indefinitely for training for the next 1, 2, 3 years. I think that a way around that might be for you to maybe take the context of the conversation, recreate the phone call with another employee, and record that for training. That way you're removing all PII, you're removing anything identifiable. You're not actually listening to the victim's voice. And there's still a way to convey the information and the tone of the conversation and how the professionals handled that without actually including the victim themselves or any of their PII. You agree with that, Talia, Mariah?
Yeah, I think you answered both questions in there. But yes, I would 100% agree. I do not think it's appropriate to record a phone conversation with a victim. And I do think that that would be a break of confidentiality.
And that would go with because the second part's talking about the therapist, a client being recorded with a therapist as well, right?
Right, especially if you're going to use it for training. There are other ways to provide that training with the example that Dale just provided, but I would not see that as appropriate.
Okay, we're going to move on to the next question, Bree. And Wendy, you're on deck for this one. Oh, Bree is on it. If there is a pay rate increase during one grant year, can I bill based on the increased pay rate? And number 2, if a personnel works 500 hours instead of 480 hours, like let's say 20 hours overtime, but the VOCA hours is only, but the VOCA hours.
Do you want me to just go through it? It's kind of 3 parts.
You just go.
So it might be easier if I answer them because they kind of build on each other. So if there's a pay increase during the grant year, can I bill based on the increased pay rate? Yes, you can. The way we have it set up now, you don't have to do an amendment if there's a pay increase. You're just going to run out of funds sooner. So you have a bucket of money for each line item, and when it's gone, it's gone. But again, make sure that those pay raises are in line with your agency's policies and procedures. You can't give someone a raise just because there are grant funds available for that. So the second part of the question is, if a person works 500 hours instead of 480 in a quarter, so let's say the quarter is supposed to have 480 hours, they work 20 hours of overtime, so they're at 500 hours. The 200 of those were VOCA, and the other 300 were not VOCA. Can I bill the full 200 hours for the VOCA grant? So yes, you can, but you can't bill it at the overtime rate unless overtime has been approved in your budget. So you could bill for those 200 hours at their standard rate if they are. Yeah, so the problem is you couldn't just say, so 200 of the 500 hours is, X percent. So I'm going to bill X percent of their total salary, because that total salary would include the overtime. So you would have to just say 200 hours at the flat rate, and that's the amount you can bill. So the last part of it is, and should I bill based on the 480 hours or the 500 hours? So this is referring to factoring the percent of hours that they're billing. So for the percent of benefits that can be billed and things of that sort. So the answer to this, we talked about this as a team to make sure we were all on the same page. So my suggestion, and the way that I look at this when I review, is I would suggest that you do 200 divided into the 480 hours, so the standard amount of hours, and not include the overtime. And there's a couple of reasons for that. One is because all of the benefits except the taxes associated with the overtime are set, and they're going to be the same whether they worked the 480 or the 500 hours. And so by dividing it into the 500 hours, you're kind of taking out of the pot of all of those other benefits that would have been the same otherwise. So my suggestion, you can do it either way, but my suggestion is that it would be to your benefit to do it into those the set 40-hour-a-week hours, as long as they do work that 40 hours a week. Now, when it comes to people who are salaried, sometimes salaried people end up working more than 40 hours a week and they don't get paid any extra for it. That's kind of the way salary works. So I'm going to split this into two parts. If a salaried person works more than 40 hours a week, and you're only billing for part of that, I would base the percentage on the 40-hour work week. So if they work 60 hours a week, every week of the quarter, you're still going to divide the number of grant hours into the standard 40-hour a week calculation. Because again, everything they're getting, their salary doesn't change. There's no additional benefits. There's no additional taxes. And so it would be quite detrimental to the amount of benefits that an agency could bill if you were trying to say 20 hours of their time was VAWA and they worked 70 hours, as opposed to 20 hours was VAWA and they worked 40 hours. So huge difference in the percentages. And then the other thing to keep in mind with salary is that if someone works less than 40 hours a week on average, then you're going to divide into the actual number. So you won't use the 40-hour a week number if they haven't actually worked that many. They only worked 320 and there was 480 available. You're going to divide the number of hours that were grant related into that 320 or whatever number I said. I hope that makes sense. That was a lot. If you need it in writing, just message me. I'll send it to you. I think that's it for that one.
Me too. I'm not gonna lie. But
You know, you guys, it can be so confusing, but once you see it on paper, it makes a lot more sense.
okay, I just want to read this question, even if we're gonna answer it. Okay, yeah. I'm gonna answer this one, then Bree, if you want to put in the one that was above it so I can let them know, we'll be answering that later. So this first one is pretty straightforward. Do we need to do 2 board reports for each UOVC grant, or can we report twice and cover all of the grants? You can report twice and cover all of the grants. You just need to make sure that in that board report that you did cover all of the grant information and not just the one, but obviously you might not even have that many board meetings. Some of you have more grants than board meetings. Okay, and then the next one was asking about the notice in regards to faith-based agencies that are required to provide. I just wanted to let this person know that we are actually going to look that up and get back to you. As far as we understand, we only have one faith-based agency, so we will follow up with you directly on that. Okay, Wendy, you got to come back because the next one is for you.
I don't think anyone wants to hear from me after that because I know I speak auditor.
It's all you. Why don't you go
sense.
ahead and read this question and then answer it?
Let's see, where are we at? So can policies be edited after they were originally submitted with the grant application? Yes. If yes, does UOVC need a new copy or just have it available in review, site visit, or audit? So you can absolutely always update your policies. We suggest that you do so as things change. You only need to send it to us if it's a policy that we have asked for. So if we say, send me your policy on record retention, and we review it and say, okay, your policy doesn't meet the standard of the certified assurances, please update it and send it back to us, then you need to send it to us. If you're just generally updating your policies and not at our request, then you don't need to send us that policy. When we do a desk review, if we ask for updates to any of the policies we've reviewed, then that's when you would send us the updated portion.
And then why don't you answer the next question as well, Wendy?
Okay. Do we need the inventory for the state funds as well? Yeah. Best practice. Just do it.
Okay. I'll go ahead and get the next few because Hildy is not signed on as a panelist, and so they're pretty straightforward though. Let's see here. Oh yes, how did we miss this one? Would it be a reportable breach of confidentiality if we are aware that a system advocate is not making it known that they will be releasing the information shared? I think we need a little bit more information on this one in order to answer that one. So if the person that asked that question can give us a little more clarifying information, that would be good. Okay. The next question. Yeah, that's the one. The LEP module focused on a lot of training for interpreters. If we are an agency that employs bilingual and bicultural staff, do we have to assess their interpretation understanding, as Cannon mentioned? Is there a trauma-informed training we could offer to them? Hildy will be following up with you on that question. Okay. Also, as part of LEP, do we need to post signage that lets clients know that they can ask for language access support? That answer is yes. If you have questions on how and where to get that signage, you can reach out to Hildy for that too. And how often does staff need to complete the civil rights and discrimination training? Once a year on the website, and it is technically, it's just the grant project manager that has to complete that. Anybody is welcome to get on the website and complete that, but the grant manager is then responsible for disseminating that information in their organization and making sure that you are complying with that. Okay, and then I see another question that came in. Can the agency refer the client to another agency that fits the client best? For example, if the client is deaf, can he or she be referred to Sega Lily for the abused deaf, or do they have to serve him? I think we might need a little bit more clarification on that question, but my understanding would be you should be serving all of those that are within your realm of service provision. So, for example, if you provide shelter, I'm sorry, and I keep shelter is just the one that sticks out in my mind. So let's say if you provide therapy services, just to stop picking on the shelter so much, and you have a client that comes in and would like to receive services, you cannot say, I can't serve you because you're deaf. You would need to be able to provide the same level of services that you would to anyone else. Now, if you're a therapy organization, that doesn't mean that you have to provide legal services to this person, but you would need to give them the same level of services, and it could not be separate because they are deaf. I would still highly recommend that you do provide referrals to other agencies that might specialize in serving them as well, because they can provide additional services, but you wouldn't be able to send someone to another agency based on their disability or any other of those protected classes that were outlined. And I hope that answered that. If not, then send a follow-up one. In regards to volunteers, what role or in what capacity can we use them? My understanding is that if she's contacted directly by a victim, I can't use those stats. I replaced the previous advocate and she's now a volunteer, but clients still contact her regularly. I'm gonna phone a friend and see if any of the grant staff have a better understanding of this question and would like to answer that. Anybody? There we go.
Which
Go
one was
Dale.
it again, Tally?
The one that says, in regards to volunteer, what role and what capacity can we use them? If she's contacted directly by the victim, we can't use those stats. Okay, hang on. I think I've got it now. It's not necessarily about using their data, as it is more volunteers are a requirement on the grant to have.
And if that is also depending on if you're taking the match waiver or not. Like that's I think that's what they're referring to as if you can count them towards the stats of your program plan. Because if you do have volunteers with your agency, but you're taking the match waiver, you have to pull those stats that you're counting out of the goals and objectives that you have submitted for your applications. So in that case, then I would say that's when you would be pulling it out if you are taking that match waiver. But if you do have volunteers for your program, which is a requirement of our grants, and they are within the scope of what you're doing, then yes, you should be able to count them if they're going towards something in your program plan. If anyone else on our team has understood this question differently than I just answered, please jump in.
Dale, this is Polly.
Thank you, Polly.
If this question is in regards to a state-funded agency, then you will be counting your volunteer. I just wanted
that. Thank you. Thank you very much, Polly. I appreciate that.
And the volunteer requirement is just for VOCA funded programs, not for VAWA, SASP, or any state funds. Okay. Are there any other questions that you guys have? I'm just trying to look through the chats as well as the Q&A, and if anybody sees anything or things that weren't answered fully.
Did we answer every question? Did we touch every question here?
That's what I want to see, because there's a lot of different chats and questions and spreadsheets I'm looking at right now, and I don't know. Okay, well, of course, you guys know you can always still reach out to us with questions. We are definitely available. We wanted to thank everybody for taking the time to attend this grant management training. We will have the recording of today as well as all the other webinars online. Please make sure that you finish watching the rest of the webinars by September 30th and you turn in that checklist to your grant manager. Also, if you have not finalized and sent in your revisions yet for your grant, do that as soon as possible. We are working very hard to get all of these grants finalized so we can be done and get going on the road with those, as I'm sure you do want that as well. Okay, with that, we are going to sign out, and good luck to all of you. Thank you.